No. Okay. Good morning, everyone. It's called court to order. Today is Tuesday, June the 30th. It's 9 a.m. Proof of posting, please.
The agenda was posted on Thursday, June 25th, 2020 at 4:05 p.m. A supplemental agenda was posted on Friday, June 26th, 2020 at 3:25 p.m. And an emergency supplemental agenda was posted on Monday, June 29th, 2020 at 3:30 p.m.
Thank you. Just to kind of give everyone a kind of heads up on how we're going to go here this morning, we've invited a couple of folks to speak this morning pertaining to the items under the COVID-19 emergency order. And before we do that, I'd like to stand briefly and have a moment of silence, and then we'll pledge to the flags, and then from there we will start and introduce the guest. Please join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Pledge to the Texas flag. Honor the Texas flag. I pledge allegiance to Texas, one state, under God, one and indivisible. Thank you. First, I would like to, is Elizabeth Thomas on? Okay, Elizabeth, if you will, kind of give us an update of today of the statistical numbers.
One second. Pulling
Good
it
morning.
up. Good morning, everyone.
Morning.
All right, from the press release yesterday, as of 3 o'clock yesterday, we had 51 new cases. There are a total of 592 active cases. There are 28 cases that are currently hospitalized. 9 of those are McLennan County residents and 3 cases are on ventilators. There are also 617 people being actively monitored, which includes positive cases and their close contacts. And we have had 8 deaths in McLennan County, unfortunately.
Thank you.
Yes, sir.
And I see that Dr. Werner is on. Got some feedback. And is Dr. Brenda Gray also on? Okay, Dr. Werner. Dr. Werner is an infectious disease specialist with the local public health district, and is very knowledgeable about the disease and has been a great resource back to the community and trying to understand what actions that need to be taken and kind of give us a good medical information regarding what actions we might take. Good morning, Dr. Werner. If you, because this meeting is recorded and it's out for the public access, if you don't mind, if you would kind of start with just a general statement and things that you'd want the community to know, and then we'll ask the commissioners if they have questions for you or Dr. Gray when she joins us as well. So good morning, sir.
Good morning. Are you requesting comments regarding generally the mask issue?
Well, the mask issue, but also the kind of what's going on in our community, what you've seen in the changes in the last couple of weeks, and why you think that's why that's happened, the increases and things like that, and then we'll open it up to questions.
Okay. Well, clearly there's a huge difference in what's happening in the county within the last couple of weeks compared to the few months before. There had been a period of relative quiet, and then now we have a dramatic increase in the number of cases. And the thing that has changed in the period immediately before that is that we've had an increase in the number of interactions between people because we've now reopened. And when you're talking about an infection that's spread from person to person, then the determinant of how many infections you have is how many person-to-person interactions there are and how many of those interactions occur and cause transmission of the infection. And so we can affect the number of cases either by preventing people from interacting, which is what staying at home and sheltering in place has done. And that's onerous and untenable and unsustainable. And now what we're doing is we've dramatically increased the number of interactions where people are interacting person to person. And to get that under control, we've got to affect the number of times when those interactions occur and transmission of the virus from one person to another occurs. And we can decrease the frequency of those interactions causing transmission by several means. One of them is keep people at least far enough apart that the virus doesn't travel from person to person, and that's the social distancing component. And the other that's becoming more and more apparent that it's an integral and crucial part of decreasing the risk of transmission is the use of masks. Masks are partly effective in protecting the wearer of the mask from breathing in or coming into contact with the virus. But the real major effect of masks in this situation is the ability to act as what we call source control, where the person who's wearing the mask, that the use of the mask traps particles and aerosols that carry the virus and cut down on the risk to the person that they're interacting with. Masks do not completely prevent transmission of virus. No one is saying that or try to say that. What is clearly becoming the case is that they are effective in significantly reducing the risk of transmission from a person who has COVID-19 to someone who doesn't. And we can see that in a couple of ways. Simple examples, if you investigate clusters of cases that are the result of a particular incident where people are together, and there's a study that looked at 17 clusters, and in 3/4 of those clusters, the event that occurred was one where people didn't wear masks. And in 1/4, people did wear masks. Not that masks were completely effective, but clearly have a significant effect on transmission in those cases. The recently publicized issue of the two hairdressers in Missouri who reopened. They saw 140 clients and found out that they were both COVID-19 positive. Everybody wore a mask, the clients, the hairdressers, and in that situation, no transmissions occurred. It's publicized because it's a dramatic example. It's an extreme, probably. the point being that there's a level of effectiveness that's real and of significant benefit. And the last point I would make about it is that that this effect is a community effect, because it's for an individual person, you reduce the risk of transmitting it to someone else. Let me put it this way: the growth in number of cases has to do with how infectious it is. The number of people that a person with COVID-19 gives the infection to. For flu, 100 people with the flu typically give flu to 130 people. Well, with COVID-19, 100 people with COVID-19 typically transmit infection to 200. So 100 this week is 200 next week, is 400 next week, is 800. And that's the exponential growth. That multiplication factor, we call the reproductive rate, is higher for COVID-19. And controlling the epidemic is going to be done by reducing that number. If we can get it to where 100 people with COVID-19 transmit it to 90 people, well, then the next week those 90 give it to 80. And over a period of time, the epidemic burns out. And what masks do in this situation is they're an effective way to reduce that rate as a community, so that over time we can hopefully bring it under control and get back to the normal state. In the past, we've asked people to social distance. We get a certain level of compliance. We're asking people to wear masks more. The effectiveness of masks in reducing the rate of transmission is directly related to the adoption rate in the community. If you can get the use of masks in these situations up to a high percentage, you have a much greater effect on the epidemic curve itself. And so the more we can do to increase the acceptance and the use of masks, the closer we're going to become to being able to truly make a difference in controlling the virus. Right now, measures are being taken to roll back this reopening. We're heading back to the more onerous and untenable measures, and the use of masks in this situation it's cheap, it's as a community, it's effective, of real benefit, and anything we can do to increase its acceptance is going to be a much less onerous way to proceed than our other options.
Right. In the contact tracing that we've done up to date, do you see any particular trends that have developed over the last several weeks that may be, whether it has to do with the amount of people at a certain age, or the racial breakdown, or the demographics that would be important for the public to know?
We're definitely seeing an increased rate in the younger population as opposed to the older age groups. We had been seeing initially with the increase higher proportion in Hispanic population that may be leveling off.
You know any reason? I guess like on the younger people, that's because they're more active in with school out or just the summertime activities are stepped up.
Well, I think they're in the specifically the 20 to 29-year-old age group. They're more socially interactive, and we're opening the door, and they're taking advantage of it. Unfortunately, it's in situations where social distancing and mask use are just not frequently adopted. And
On the increase of positive cases in the Hispanic community, do you see a way or what you could recommend how our community can help curb that alarming trend for that group?
getting the message to that population of the dangers of COVID-19 and the ways to limit its spread is going to be important. I think I know Dr. Gray I'd say better able to discuss it fluently. Was she on the call today too?
Is Dr. Gray on? Y'all seen her? I don't believe she's been able to make it, but we will follow up with that and ask her that question. Commissioners, do y'all have questions for Dr. Verner?
Yes, I would. Sir, what are there other strategies that should be considered and employed as well?
In addition to the ones that are being repeated, the social distancing, the hand washing, sanitization, and mask use, the sum effect of all of those is of real importance right now. The effort to identify cases, meaning that if you have symptoms, you seek evaluation and testing. The sooner we identify a person with COVID-19, then from a public health standpoint, we can help that person understand the requirement of their isolation. We can identify people who are actual close contacts and at higher risk and isolate them with appropriate quarantine measures through their potential incubation period. So that component, containment of infection, is critical along with the mitigation efforts that we had been talking about. As far as novel means of controlling it, no, I don't have something that I've thought of ahead of everybody else, no.
And thank you, sir. And then lastly, we've got a holiday weekend coming up, which I think most would agree. The last holiday weekend was somewhat of a spark that's got us to where we're at now. What numbers would you suggest or recommend that if you're having a gathering, what number would you say, hey, it's probably best if you have 15 or 20, I don't know what the number may be, but if you have that many people over, you would recommend masks?
So I would look at it this way, whether if you have a group of 20 people and and or you have 4 groups of 5 people meeting. In effect, you've had the same thing happen. And the difference is that in a bigger group, you're just more likely to have one person infected at that particular time. But if you're having 4 groups of 5 people at the same time, well, one of those groups is going to have a person who's infected in it potentially. And so my recommendation is that you look at it in a different way. If you are in your household are safe or relatively safe because you've been following the rules, and you have friends and family that are in different households that you want to socialize with, that as you get together, that's when you should wear a mask. That's at those kind of gatherings, because the risk is that somebody in the group who has been out in the community because they have to work, they have to, they become exposed. And then in those situations where people are socializing, that's when transmission occurs, and that's when you have these clusters that we're having right now. We've had numerous clusters within families and social groups that get together. So if you're getting together with people that are not in your household, then you're taking a risk. You can't say it any other way. It's a risk to go out and socialize. So what can you do to minimize your risk? Well, you still social distance and you wear a mask. And to do that at what people consider as special events, birthday parties, 4th of July parties, informal parties, well, it's where we get our lowest acceptance rate of those measures, and it's where we're having high transmission rates. And it will get worse as the number of people in the community who are infected, well, for their 2 days before they have symptoms, and they're not following guidelines, that's when we're getting transmissions. So I see 4th of July type events as being particularly an issue, because we're just going to have that many more times when people decide, well, we're going to get together, it's a special occasion, and you have to realize that, yep, you're definitely taking a risk, and we're going to see an increased number of cases as a result.
Thank you, sir.
Thank you. Any other questions?
I have a question
Yes,
for Dr. Varner. And I guess it's Dallas County and Travis County have had mandatory mask orders for almost a month, or well, I don't know for sure, but they're the first ones that I heard about. Their cases are still at record highs. How can you explain that?
There's a definite lag time in making an intervention and seeing the result, and this has to do with the fact that the incubation period, the time from exposure to symptoms, is 2 to 14 days and averages 5 days or more. So it's on average 5 days a week before a person is aware that they need to get tested. Right now, with testing that's in place, unfortunately, there's a lag time between the time you get tested and when you get your results. 3 to 4 days is common. And then you have, it takes a while for that week-to-week increase to take effect. And it's why I think we're seeing locally our increase lagging a month or more behind these reopening efforts. And it's also hard to pull out the effect of one particular intervention on the whole shape of the epidemic curve. Again, I'm not saying that that this particular intervention, mask use, is the answer in and of itself. And prior to the mandate of mask use in those communities, it was already strongly recommended, and adoption of masks had been partial at best. So the record number of cases I don't take it as evidence that it's not beneficial, only that the epidemic itself is hard to control.
So I think that goes back to the point that I made yesterday, that no matter what mitigation strategy we use, all of the models point to the same amount of people getting the virus. And the research that I've done is that no matter what we do, the same amount of people get the virus.
I would not be able to agree with that. No.
Okay.
So we're actually trying to completely stop the spread of the virus.
No. I mean, if you take the New York and the measures they've instituted and the control that they've been able to get of the infection, that wasn't because the virus ran out of people to infect. It's a result of the measures that are instituted. And the effect of mitigation efforts and containment efforts is spread out over time. I think what you may be referring to is the idea of flattening the curve, that we're spreading out the number of infections, and that's also true. But if you have efforts that in summation change the number of the effective, or change the infectivity rate, the reproductive rate, then you can over time actually control the infection. So no, these mitigation efforts are not stopping transmission, but they're definitely reducing it.
Thank you. Any other questions?
I did. I had one. What you said, Dr. Vanier, about the partial effect of mask. helping even the wearer. I'd always thought that it had to be some type of benefit if you're protecting your face, but I had not heard it spoke or addressed by the medical community. Could you elaborate a little bit more when you talk about a partial effect of masks for the person actually wearing the mask?
So masks work in two ways. They act as a filter to prevent things that you breathe in from getting through, and you know, they filter out the virus as you breathe. Masks, the disposable masks, homemade masks, and even surgical masks have a fair amount of leakage around, so that the aerosols that are around in higher concentrations can still get around the mask. But the protection, and so they're of some benefit, but limited benefit to the mask wearer. But the greater proportion of benefit has to do with the person who's wearing the mask, who doesn't know they have COVID-19. They're in that period of time whether they don't have symptoms yet or they'll never get symptoms, when just in talking and even more in coughing, but even just in talking, they're generating aerosols, droplets, and masks are effective in trapping those. When you breathe out through the mask, they by no means stop all of it, but they are effective in significantly reducing the number of virus that are spread by the person wearing the mask. And that's where the main benefit of mask wearing comes in, is not for the person who's wearing it. You wearing a mask protects other people, and you get protection if other people will wear masks.
Okay, thank you.
Dr. Verner, I have one more question that was sent to me to ask. If a mask order is enacted, what metrics would you look at to remove it? In other words, is there a positivity rate that would maybe be an indicator, or hospital capacity, or those things? Do you have any thoughts on that?
No, increasing the use of masks is going to be part of all of those mitigation efforts, and not going to be able to pull out the effectiveness of it and say we can stop doing this or we can stop doing that. I would see it as becoming part of the social distancing in the long run. Mandated or not, I expect mask use may be one of the very last things that we say should be stopped, and before getting back to completely pre-COVID social interactions.
Thank you. Well, we really appreciate your time this morning. Very helpful. And if there's additional questions that come up as we move through the agenda, I will give you a call and get answers to those, or encourage the commissioners to make direct contact with you if they want additional information, also with Dr. Gray as well. Thank you, sir.
Appreciate the opportunity.
Thank you, sir. Okay, I would like to go to the under the supplemental agenda under C, the consideration or action on the emergency plan, following emergency plan under C2 is the order declaring and extending the state, wait a minute, no, under C1, and Dustin, feel free to jump in and be sure I'm on the right ones here. But a resolution under C1 making recommendations regarding face mask coverings and other preventive measures in lieu of mandating business to enforce that. And then the other would be whether the court consider to adopt an order that would require businesses to enforce it. So,
And Judge, the actual order is G6 on the regular agenda.
okay.
That's the order requiring businesses to establish, and then what you've gone to is correct under C1. That would be the resolution that could be enacted as an alternate to that order.
Under G6 is discussion or consideration potential action on adopting of an order requesting businesses to establishing COVID-19 policies acceptable to employees and customers, applicable to employees and customers, including face coverings, sanitations, and social distancing. So Dustin or Mike, I guess I'd open up to the court. Since we've already kind of looked at this yesterday, so any other thoughts that any of the court members might have regarding that?
Well, I did this morning ask Dustin and Mike if they could draw something up reflective of Bell County's order that we could look at.
And Bell, I guess the reference Bell County would be that the county judge enacted the order sometime back, and when it went to ratification to the commissioners, after long discussion, modified that order to be pretty much the same, except it did not have enforcement on the business or fines on the business. Is that right?
That's
what
my
you
understanding, and
understand
I think we'd need to ask Dustin and Mike at this time if that's what it reflects.
Me myself, I'd like to see something like that. I think we put enough burden on our local businesses to have something in place that they've got to worry about getting fined over. I mean, they're already limiting their hours, limiting their operation. They're struggling to make it as it is. We just don't need to pile anything else on top of it. I think, in a lot of businesses I've been into, you see them every day. They've got the sign on the door. People are wearing masks. I mean, I think people do it on their own. I don't think we really need to mandate it.
I read the Bell County order. Commissioner Perry, is there a document that Mike and Dustin have available for us today, or is it something that we're going to expect to see in the future?
No, I don't have a copy of it. I just called this morning and asked them if they would have something prepared that we could get to the court, whether it be in the beginning of our court today or we hold to the end, where we can get everybody a copy of it.
And Judge, Mike sent one over, emailed about 9:31. I will ask Cody to send that out to all members of the court, and then after it's reviewed, we can discuss. And Mike may be having trouble again. I know yesterday he couldn't unmute. I see he's still muted, so he may be trying to comment as well.
I can say I would like to see the document that Commissioner Perry is bringing forward. I read the Bell County order, and I like it. Is Mike trying to talk?
Oh, I just wanted to make sure whether I was even on or not.
Okay.
I've been saying hello, hello, hello.
We can hear you now. And I'm going to wrap up so you can speak. But like I was saying, I like the Bell County order. And I understand what Commissioner Perry's saying and Commissioner Snell. I agree with that, given the fact that we cannot impose any type of civil or criminal penalty on a person who would not adhere to their order. So we shouldn't penalize them, the business either. So if we just take out, I think it's Section E that says there would be a fine if they didn't put forth a policy. If we take that out, I'd like to see what it looks like. But in lieu of waiting for that document. I'd like to come back to this discussion because I would like to see what that new document would look like.
Okay,
And it has been, if I can get it down to you from the Cody, it has been done, and it really would take about 2 minutes to read because it's what it makes. It strongly recommends that a policy is adopted that includes face covering and other CDC guidelines. Takes out the penalty and doesn't go into a lot of the other stuff that isn't relevant once you change it from you have to a recommendation.
Well, what's the difference between a resolution and an order? I guess is the question. If we're not going to have any sort of enforcement or anything like that, why wouldn't we just offer up a resolution asking for to use mask and use common sense and things like that, like C1 on the
Commissioner Jones, whenever you're looking away from your deal, we can't hear you. So if you could speak directly into the.
Sorry about that.
Right.
What's the difference between the resolution and the order?
Well, an order generally it carries a little more weight. I mean, it's people are used to seeing orders, and I think the fact that Bell County changed their order up, I think it just was the thought that maybe having it in the form of order was more would be more effective.
Would it also be that other entities within the county, is it easier to adopt an order than it is a resolution if they choose?
It is. Plus, this order specifically says that it's not intended to affect any orders of cities that have chosen to impose regulations like the ones that we are recommending.
And that's what you were kind of getting at yesterday, to allow them to customize to their
Correct.
community. Okay, well, I think if I understand it right, everybody was just emailed that, and if y'all like, we can have Dustin or Mike just read the order now, and we don't have to hold it. We can deal with it now. Thank you.
Dustin, could you do that?
Sure, let me jump over. Okay, this is an order of the County Judge and Commissioners Court of McLennan County, Texas, making recommendations to businesses for best practices to prevent the spread of COVID-19. Whereas by virtue of the governor's executive orders, non-essential businesses and services were closed and certain other restrictions were put in place in an attempt to control the spread of COVID-19. And whereas the governor's executive orders have reopened previously closed businesses and services and withdrawn certain restrictions. Whereas this order is issued based on evidence of increasing occurrence of COVID-19 within the county and throughout the Central Texas area, scientific evidence and best practices regarding the most effective approaches to slow the transmission of communicable diseases generally and COVID-19 specifically, and evidence that the age, condition, and health of a significant portion of the population of the county places it at risk for serious health complications, including death from COVID-19. And whereas a declaration of local disaster and public health emergency includes the ability to reduce the possibility of exposure to disease, control the risk, promote health, compel persons to undergo additional health measures that prevent or control the spread of disease. Now, therefore, be it ordered by County Judge Scott M. Felton and the Commissioners Court of McLennan County, Texas, under the authority of Texas Government Code Section 418.108 and other law. 1. Health and safety policy, commercial entities. A, it is strongly recommended that every commercial entity in McLennan County, Texas, providing goods or services directly to the public should develop and implement a health and safety policy. The health and safety policy should require at a minimum that every employee or visitor to the commercial entity's business premises or other facilities wear a face covering when in an undivided room or area with coworkers or the public, or while performing an activity which necessarily involves or is reasonably likely to involve close proximity to coworkers or the public, such that 6 feet of separation is not feasible. Commercial entity as used herein does not include outdoor operations where social distancing is generally followed, offices of other governmental entities, churches, or health providers that already have policies in place that have been medically vetted. Face covering as used herein means a cloth or paper mask or a bandana or scarf that covers the mouth and nose and fits tightly to the face and does not merely hang over the mouth and nose. Face shields are not face coverings because they are open at the bottom. C, the health and safety policy is strongly recommended to be developed and implemented to also include the implementation of other mitigating measures designed to control and reduce the transmission of COVID-19, such as temperature checks or health screenings for employees and provision of hand sanitizer stations for both employees and customers. 2, that this order shall become effective immediately. 3, that the county must promptly provide notice of this order by posting it on the county website and by filing it with the county clerk. 4, this does not override the orders of any city within McLennan County that require measures like those recommended herein and is not intended to affect those orders in any way. 5, that if any subsection, sentence, clause, phrase, or word of this order or any application of it to any person, structure, gathering, or circumstance is held to be invalid or unconstitutional by a decision of a court of competent jurisdiction, then such decision will not affect the validity of the remaining portions or application of this order. Ordered on this, the 30th day of June 2020, being the effective date.
Okay, any thoughts? Commissioner Perry, does that fit kind of what you're talking about?
I think it's very well worded. I do like and appreciate the efforts, Mike and Dustin, on this.
So what is the intent of having that there? I mean, we don't want to fine anybody, so that doesn't do that. Is that just in case somebody doesn't know and they just want something to look at to read? I mean,
It would be, they could go to our website to see what the order is. And from there, they can find out the details on it.
but I mean,
Well, and it's meant as a recommendation. And, you know, some people do look to the governmental entities for recommendations on how to handle things. And this would be our recommendation, or the county's recommendation on how to handle this situation without forcing it.
right, it'd just be a recommendation. The cities could still do what the cities want to do and the businesses would not be fined, correct?
Correct.
Yeah. And that was one of the points Commissioner Perry made yesterday. And I think Commissioner Jones had talked to some of the cities in his precinct. And I know you had visited some with yours, and I did as well. And so this really gives them the flexibility to create. It does not prevent them from creating an order within their city limits specifically for their area. Is that right, Dustin or Mike?
That's correct.
Yeah. Okay.
I had one question. I just need a clarification. Speaking of cities within precinct 2, I saw yesterday where even the city of Mark has now implemented a mask wearing policy. And I really don't want to pull the carpet from underneath those cities that have been proactive in trying to address the increase in COVID activity here. So when we say should, like Bell County says shall, Mike, what are we saying? Because Bell County is saying they shall require, and we're saying at a minimum they should. So just on semantics, what's the difference in those two, should and shall?
Well, we're making a recommendation. What Bell County did was just take out the punishment, but it really doesn't fit to have shall, and then no enforcement remedy. So I tailored it to be more like a recommendation where it should instead of shall, because we are making a recommendation. We're not mandating.
Right. I guess one of the things that I liked at least in the resolution, is that we said if we saw an upward trend in the new cases, that we would be prepared to implement additional restrictions. But we don't say that in this order. And I'm kind of like missing a snail. We're not just passing a resolution in an order just to do an exercise. The situation before us is serious. Our numbers are climbing, our deaths are increasing. Although, let me say, yesterday, I saw my 7 as a 9. It was 7, but today we're now at 8. So the seriousness of COVID-19 should not get past us, and I don't think it is. I don't mean to imply that on the court. I think the science that we have heard from the Medical Society yesterday and Dr. Vernier today needs to weigh on us that we have been allowing people to have discretion. We have been already under an environment where those who would wear a mask are wearing it, and those who didn't want to, well, they don't. And we see where that has us. So in doing an action, I would think we would do one that would affect the numbers. Like Dr. Vernier said, what we do needs to reflect in the numbers as days go by. And so if we're just, like Department of State Health Services, they tell people to consider. The governor tells people that he encourages. And if we tell people we strongly recommend, we still leave a gap for some people not to do it and not to help and assist and protect the community. And if we're going to do that, then I think we need to also include in here, if we don't see where this order is doing having any effect, we need to tell people that we're going to be prepared to come back, revisit, and take even stronger actions like we do in the resolution. I don't see that wording in this order.
Well, I can add that as number 6 to this order, or add it actually as number 5 and change 5 to 6. Take that same language and put it in this order.
Real quick,
In the Bell County order, if we are looking to give guidance to our local municipalities that are looking to us for some, I'm looking away. I'm looking at another screen to read the Bell County order. They in there have a section about when face coverings do not need to be worn, exercising inside or outside, engaging in physical activity outside, driving alone with passengers who are not a part of the same household. When doing so possesses a greater mental or physical health, safety, or security risk while pumping gas or operating outdoor equipment while in a building or activity that requires security surveillance or screening, or example at banks, when consuming food or drink. If we're looking to give guidance, I think we need to add those type of guidances also too.
Well, those are like if you're passing a population-wide mask requirement, because this is limited just to businesses. So really, not requiring it for them to go outside and exercise and stuff is more of like what Austin had, where they were requiring it for everybody until the governor pulled the rug out from under everyone. So I don't know that. I mean, really, what we're concentrating on is just in the workplace, in the customer employee exchange type situations. So we're even more reduced than something that would indicate a broader face covering requirement.
And
Well,
something-
I just thought we were trying to give guidance, so,
Mr. Perry?
Well, something that I was going to comment, I spoke with someone yesterday that is very in favor of a mask order. And one of the biggest complaints was in two of the communities that this person had been in front of businesses, people were not wearing masks anyway. They were coming and going. And to me, if we're going to do something similar to this, there are people out there that will be compliant and work with you if at the prior suggestion, but the minute you say shall, you've lost them. And I think that's more of what this is getting at is we've agreed yesterday and talked to a couple of the folks from the Waco City Council. Our community has really done a fantastic job of participating all the way back from shelter in place. And I think that we get more participation than what we realize. And I think adopting an order such as this is beneficial to the smaller municipalities. It doesn't preclude them from enacting another order. But we are a community that's already working with us. We're just asking for additional participation. And sometimes when you put shall in something, you're instantly going to drive someone a wedge between you and that person and whatever behavior we're trying to influence.
I think that makes a good point. I think what we're going to see is you're going to have people that are going to adhere to it and you're going to have people who don't. I'm just hoping that the majority of us take into account that we are our brother's keeper. I want to ask if we could also incorporate, because I don't see that wording in this, can we incorporate, or is it already implied, the governor's executive order GA 28? Can we incorporate that into this order? Because it does speak to some other things that we haven't mentioned. For instance, when we were talking about over the holidays, and in the governor's order, it says that people should not be in groups larger than 10. And the only reason I would like to do that, again, I just want to restate, our numbers make this a serious issue. And I would just like to see us do everything possible to curtail those numbers from continuing to go up. So I understand the wording as it is, especially since we don't have any enforcement. And I thank you, Mike, for adding the wording about, though, as we look at the trend, we may be prepared to come back and do something more stringent. But I'd also like to add in there that our order incorporates the governor's executive order GA 28 to give people guidance on those additional behaviors and also on the hygiene containment issues that Dr. Vanier spoke to.
Okay, I mean, that's not a problem.
Okay.
So are y'all okay with the things that we've added to let him go ahead and do it? And then, or do you want to see the modifications back? If so, Mike, if you'll make those changes and send them.
I'll email him here in a minute.
Okay. Okay. We'll hold that just for a minute. Dustin, under that, what would be the next item we should go to while course, Mike's going to be working on that draft, but you may be able to address most of these things.
Let's see. We could go on to discuss. Sorry, I'm trying to find the order for the county employees, the temperature screening order.
Is that item C2?
No, C2 extends the state of disaster through
Yeah.
July 28th. That would mirror what the city of Waco is doing. So if the court wants to take action on that, we could do that now as well.
Okay, and then also under C3 is discussion or action on addendum to agreement with Core Health LLC, medical services for the jail facilities for Core Health to provide or cause to be provided temporary nursing staff to assist the jail facilities.
And Judge Major Armstrong is on the line. He can probably.
Okay, well, let's go to item C3, what I just mentioned there. And Major Armstrong, if you can kind of tell us what the issues are.
Yeah, we have had 3 nurses test positive so far out of our staffing, and we're just looking to the future to make sure that we are able to continue our medical to the inmates to hire on this alternative nursing through Core Health. They'll manage the contract and manage the nurses, and we're just asking for them to be able to do that.
I have received the contract this morning. I just need, it looks in good shape. The only thing I need to do is add a Schedule A, which identifies the rates of the nurses. Ricky, do you have that in front of you?
I don't have the contract in front of me. I did read it. I saw the rates. LVNs, I think, were 48 and LVN or RNs were 65, or it was close to that. But I have that email. If you don't have it, I can send it to you.
Yeah, no, I've got it. I just was, I want to find, okay, yeah, that's what I need to do. I think it's 40 something for LVN, 60 something for RNs per hour.
Correct.
And then there's a 10% management fee to Core Health on top of that, because they will be responsible for managing those nurses.
Managing and scheduling, yeah, that's what they're asking for.
So this is, first of all, proactive because we may need some now, but it's also planning because we don't know how many more will be down in the future.
Correct.
And so we need a quick and easy source to pull in temps.
And this is quick for us because they already have a contract with Core Health. This is just them to be able to work in our facility.
Major, do you see any issues allowing them to do the scheduling and the management of that?
No, because they'll work directly with our director of nursing and he'll be the only one asking for staffing. I told him to be very cognizant of what we need and make sure it's COVID related at this point to cover our jail.
And we will be keeping track of this because this is something that should be reimbursable under the grant.
Right.
Oh, okay.
Okay.
So what is the price difference, Ricky, between what we're paying now and what this is? Is it going to be more expensive or?
It's probably, it's a little more expensive because it's agency nursing. It's part-time, in the need.
Right.
I'm not sure what our nurses make per hour. But I'm sure it is a little more expensive.
Any other questions for the major? What's the pleasure of the court on C3?
Make a motion to approve C3.
Second.
Motion made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller,
Aye.
Judge Bolton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass.
Thank you.
Dustin, do you want to go to extension of the order? This would be C2. Discussion or action on an order declaring extending a state of disaster and public health emergency for and in McLennan County through July the 28th, 2020.
Yes, sir. And what this does, this aligns the city, and Mike can probably chime in a little too, but the city this afternoon is going to consider extending their disaster declaration through July 28th. So that would just align us with them.
Okay. Okay, what's the pleasure of the court?
Make a motion to approve C2.
Second.
Motion and a second. Any other discussion? No other discussion. Call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller. Judge Felton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass.
I just sent the revised order to Dustin. The sections that were changed are highlighted for your convenience.
Okay, could you read those in, Dustin?
Yes, sir. Let me jump over to my email real quick.
Okay.
It may take me just a second, Judge. I've got a.
While he's looking, Colin is asking whether the
He didn't say.
the nursing additions or the nursing contract could cover juvenile as well. I think that it would. I think our original document includes juvenile, doesn't it?
I think the amendment included juvenile as well.
Okay.
I agree.
Okay, going back to the order, it renumbered 5, 6, and 7. Number 5 will be if the numbers continue to rise, the Commissioners Court will be forced to consider mandatory requirements. Number 6, as the Governor's Executive Order GA 28 is incorporated herein. And then number 7 became the that if any subsection, sentence, et cetera, it said it will not affect the validity of the remaining portion or application of this order.
Everybody clear on those changes? What's the pleasure of the court?
I'd make a motion that we adopt the order and the modifications to it that we just received.
Second.
Motion been made and second. Any other discussion? No other discussion. Call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Jones,
Commissioner Jones?
Commissioner Perry.
Aye.
Okay, pass.
Judge, G4 is the order of establishing a county facility operating plan to prevent the spread of COVID-19. That's the one we began discussing yesterday, and I know Commissioner Miller had some questions on the leave portion of it, but I can kind of run back through and summarize what this does, and then we can address those questions if that's okay.
Yes.
All right, so what this does, we had initially kind of set out a reopening guide for county offices, and it talked about the routine environmental cleaning, hand sanitizer stations. That just puts these in kind of a formal operating plan. It also goes through and says that all employees will receive a temperature screening upon entering a county facility at the beginning of their shift business day. Each office and department will assign an employee from their department or office to conduct that temperature screening. Then employees with a temperature reading of 99.6 or greater will be sent home. It also says that temperature screenings will be conducted for any individual entering county facilities that house a courtroom, including employees, judges, litigants, attorneys, and general visitors. Then it goes on to state that employees working directly with the public on a walk-in basis must wear a protective mask while dealing with each customer where social distancing cannot be maintained. In offices, departments where employees work directly with the public on a walk-in basis, the public visitors will be required to wear a mask where social distancing cannot be maintained. And then department heads and elected officials may impose stricter mask policies on employees based on the inability to socially distance in their areas, such as in their halls, break rooms, or other general areas. It does go on to say that an employee or visitor who has a documented medical condition that makes wearing a mask likely to cause adverse symptoms or aggravation of their condition, they're not required to wear a mask, but should practice social distancing where possible. And that's a summary of it, except for the leave portion.
Okay. And this is, this all lays within what what Judge Strother has submitted to the Office of Court Administration under their requirements. So we will help assist them in meeting those requirements.
That's correct. And I checked with Ken this morning, and I believe we have around 50 non-contact thermometers on hand that could go to departments as well.
Okay. Yes, sir. Okay. Any questions about that?
Well, the question that Pat had yesterday about sending them home, is that addressed in this order or in this in-4?
It's addressed in that we'd say that, if you've used up all your paid leave, including your FFRCP or whatever it's called, it may be leave without pay. The deal is we have generous leave policies. We adopted a leave program before the federal government ever came out with it. So essentially we ended up giving a few days extra. Most people still have their federal leave. Then, there's the ability to take additional unpaid time under the FMLA. But what they need to do to qualify for the federal leave is if they're sent home with a fever, then they have to go see a healthcare provider. And those two together make them qualified for that leave. Now, it's a 3-day leave. They go to the healthcare provider. The healthcare provider finds other symptoms and gets them tested, and they're positive, then they'll be out for longer. But it's the problem is that we don't know how long all this stuff is going to go on, and the concept of doing administrative leave for everybody, it kind of is a financial unknown, and it's not it's nobody's fault that somebody gets sick, but the fact is that's what leave is for.
Well, I just think it's important that we don't, if there's a way to get them paid, but as far as, we're closing businesses every day and limiting people's work hours that are paying our salaries. I just want us to be on the same playing field as the other businesses. I mean, sometimes you just don't get paid when you're off. We see that every day right now. There's a lot of people not getting paid.
I think there's only 3.5% of the county that is exhausted their federal leave. There's quite a lot of leave left. for most. I mean, there are the exceptions, but you know, there's just so much you can do.
Right. I had a question, and I'm looking at it holistically over all county employees. I'm not looking at the group specifically that went out because of childcare issues, and I'm not looking specifically at the group that went out because they had underlying conditions. Just looking at the workforce totally. If you have an employee that shows up for work, and this could be an employee that's worked this whole entire time, but they screen according to our policy where we would have to send them home. And I look at it, if it were me, if I, kept my vacation and I'm trying to wait to the end of COVID, and I've made sure that I've been responsible with my sick leave in case I have to have a surgery or if I'm out with, a child, then this is not my fault if I come into work and I test at the 99.6 or above. So I'm looking at it across the broad spectrum of all employees in the county. I did hear you say the federal leave policy. My question would be, because I know we budget for employees, over the course of a year, we budget their annual salary. What is, because I don't want to put myself in a legal issue where we create a policy that adversely affects the employee that they didn't ask for. So what is the path forward as far as compensation just for any employee, not necessarily someone who was out with childcare, not necessarily someone with underlying conditions, but for a healthy employee coming into work and then all of a sudden they register at 99.6 and we send them home for 3 days?
Well, I definitely understand the equitable side of it. It's just that, if they do read with a fever, then it's the same as being sick as far as the COVID type protocols are considered. So, I mean, I don't know that we don't have any liability because actually we're at will. We have at will employment, but I from a standpoint of the employees, I can understand, the equitable desire to do something for them, and it is, but we do have their salaries budgeted, but I'm afraid that we already have in place leave policies, and then on top of that, federal leave policies for COVID. And that would seem to be where we should look at, rather than creating some sort of new source of funding.
I wouldn't create a new source. I'm just wondering the pros and cons. We're saying that you may be sent home on unpaid leave. I don't know why we couldn't send them home on paid leave, because it's positive, if it does go on to be a further extension of COVID-19 and they're home for the 10 to 14 days, then I think we have a policy in place that covers that, don't we? For them, they apply for that sick leave through.
Well, they apply for their federal leave, and it can, if they exceed that, then they could apply. Oh no, that's only for people with childcare deals. I think.
This is Amanda. Can I jump in?
Yeah.
So if our employees are actually receiving the temperature indicator on our thermometers and they're being sent home due to that reason alone, they would be able to utilize their sick leave benefit for that particular time. So if they have sick leave accrued in their bank of balance, they would be able to utilize that time. If they are additionally seeking medical care because it's been identified that they have a fever, they will be able to complete the FFCRA form and request the FFCRA leave. If they qualify for that leave and have not already exhausted that time would then begin to be effective for the period of time they would be out of the office. We're stating it's a minimum of 3 days, but in reality it is they need to be fever-free for 3 days without the use of fever-reducing medications. So it's the potential they could be out longer than the 3 days. I want to be sure that's clear for everyone on the call. So the first thing that would be applied would be their sick leave. The second leave would be if they apply for the FFCRA leave. Most likely they would qualify because they have a symptom, and if they choose to seek medical assistance, they would then qualify for that FFCRA leave. And then from there, we would identify what any additional benefits may or may not apply. So the only cases where they would receive unpaid time is if they have exhausted all of their sick leave balance, have exhausted all their FFCRA leave balance, and do not qualify for any medical condition type of family medical leave or child care FFCRA leave.
For clarification, Amanda, tell me one more time, FFCRA leave, that family first, what does that acronym stand for?
It's Families
First Coronavirus Relief Act.
That's Amy.
Okay. And
Families First Coronavirus Relief Act.
okay, and so that covers funds for employees that would be out that are not related to childcare issues?
Yes, it covers both, actually. It's whether you're out for childcare, you can use it for childcare absences, or you can use it for your own health situations.
Okay. So if I'm an employee, if I come into work and I register a fever of 100, according to what we're saying, the first thing that HR is going to do is find me eligible for that funding for those days I would be out, correct?
They would have to also be willing to seek medical assistance.
So
Right.
it would be sick leave until they went and received medical assistance. You know, it would be sick leave. If they received medical assistance, I guess we could tie it back to the starting date, but
That's not been our practice, Mike.
okay, so we would be starting the federal leave when they actually see the doctor, but until then they'd be on sick leave.
Actually, it's as soon as we receive the completed FFCRA leave request form, and if they complete that form indicating both that they have a symptom and are seeking medical assistance, we would qualify them on the date we receive that document for the FFCRA 80 hours of leave.
That's right. We talked about that the other day.
Okay. Okay. That answers my question, Judge.
Any other questions?
I have a
Okay.
question.
Yes, sir.
How, I guess how many folks have exhausted their time?
Hold on, I've got that.
I have it available, Mike. So
Okay.
we have 186 employees that have currently qualified for the FFCRA 80 hours of leave benefit. Of those employees, 40 of those employees have already exhausted their FFCRA 80 hours of leave benefit. So of our total employee population, only 3.5% of our employees have exhausted those hours. If you look at the percentage based on those that are using the leave, 22% of those using the leave have exhausted the time.
And are they are these mainly people that are going to be affected by this policy, by the temperature screening policy?
If this particular item on the agenda is approved, this is requiring every office and department in the county to begin temperature screenings. So yes, all of these employees that are currently on the FFCRA leave would be impacted potentially.
But it would impact all employees, you know, even the ones that haven't used theirs yet. If they come up with a temperature, they may end up having to use some of their FFCRA time if they go see a doctor.
That is correct. And so just to point out, not everyone that has a fever has COVID-19.
Well, I
And
think
not everyone that has COVID-19 has a fever.
That is also true.
Not everybody that gets COVID-19 dies either. So
okay. That really clears up for me the concern I had yesterday. I would just ask the process for employees under this policy, if we can make it clear and concise and send it out to them. Because I'm looking at that employee, if I came into work and I register 100-degree temperature, then I could go to HR or I could get it online. I could fill out the form. If I'm registering that temperature, I would go in and seek a COVID test if I don't think that I'm sick for any other reason. So I would go to the doctor. So if I don't have COVID, if I just have cold, you know, the doctor's excuse lets me come back to work, and FFCRA covers me on my sick leave. If I do go to the doctor and God forbid I do have COVID-19, FFCRA covers me. And it also covers, I know, up to those 10 days that we're asking people to stay away. So I think we undergird them. I just didn't want to implement cripple employees any more than some of them have been crippled during this time. So I'm glad to get that clarification from Mike and Amanda.
So I would like to speak to that a little bit. Obviously, we're seeing that not all employees are tested. It, again, is a medical provider's determination as to whether that test is needed or required based on the symptoms they have. Additionally, if a medical provider decides to conduct that test, it can take anywhere between 2 and 3 days or sometimes longer to get those test results. So, you know, that can impact that period of time that employee is out of the office. And then the medical provider also creates that determination on when it's safe for that employee to return to work. So if we qualify them based on the form submission and they meet the requirements on the form submission, they can begin utilizing those FFCRA 80 hours of leave time, but it may not get them all the way through that quarantine period. In most cases, it has provided coverage during that quarantine period, but I'm just expressing that may not always be the case.
But in those cases, we would hope that they have some form of paid leave that they could use for the couple of days that is different.
Exactly. Most of our employees have sick leave balances that would be applied in this situation.
In an extreme case, would the sick leave pool be available to an employee?
No, the sick leave pool is considered for catastrophic
Cancer, things like that.
It's like cancer, heart attack, you know, that sort of stuff. It's more for a catastrophic injury that requires long-term recovery or long-term treatment.
I think, talking about two different things here. One is the order that we are talking about that we need to implement. The consequences of the order bring it into a personnel issue, which wouldn't we deal with that separately? In other words, not let that stand in the way of approving this order on how we, our opening plan for our facility.
Right, Judge, and I mean, we're gonna try to handle every case as fairly as possible. But yeah, the order is the primary thing we're talking about today, just so we can actually start in our own operations, making sure we're doing everything we can to keep our employees and our customers safe. Because mainly this is about counter type service and walk-ins and stuff like that into your business, and different places like the jail. It's everywhere because you're dealing with somebody face to face pretty much everywhere, and they do all wear masks.
Okay, well, I'd like to make a motion that we approve this order under G4. And then if it passes, then the consequences are a personnel issue. And because we're under COVID-19 emergency meeting, we can bring back the personnel issue separately, maybe even towards the end of this meeting. I'd like to get on with a break and then start the department head reports and then come back and finish up the agenda. So if HR and legal wants to work on that, we can come back to it at the end. If we can't resolve it, we'll put it off we'll work on it till the next scheduled meeting.
Well, Judge, I think that that HR and legal have stated everything we can do right now. So I don't know that there's, unless Commissioner Miller has any other questions, I think she said that we had addressed her questions.
Okay.
I did, because you had.
Okay, I have made a motion. Is there a second?
Second.
Motion been made and second. Any other discussion? No other discussion. Call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Passed. Okay, I would like to have go into a 5-minute recess, and we'll come back and start the department head reports. Thank you.
No.
It's not now.
question.
Okay. A little late. All right, I'm ready. Okay. All right, let's call court back into session. We'll go to items D under acceptance of county department heads, staff departmental reports and updates. I would, as you've heard me say before, and I think I'm speaking for the commissioners, but if not, feel free to join in. But we received these reports, and I started on this morning trying to read as much of it as I could. Some of these reports are really very detailed, and I appreciate all the hard work that went into putting them together. I think if you could hit the high points of your report, and one of the things that we're really interested in is what are your challenges? What have been some of the challenges that you've overcome in the past, as well as how has the COVID-19 situation affected your department? And not so much all the detail that you have in the reports, which are very detailed and very good. And I know a lot of hard work was in there. And then I asked anybody, all the Commissioner Court members to, any questions, jump in there and ask them either while they're giving the report or at the end of their report. Going to under D1 is juvenile probation. It's a monthly activity report that goes from February through May of 2020. So I think Cotton Coker will be giving that report.
Hello.
Good morning, sir.
Good morning. Thank you, Your Honor, Commissioners. Just some generic information, and I'd be more than happy to answer any questions specific to the COVID pandemic and precautions. During those, during February, March, April, and May, we had a total of 157 referrals come through. During that time, we had a total of 147 juveniles placed on on probation, 83 on deferred prosecution, 108 on conditions of release or detention. We started February with 9 juveniles in our detention facility. We placed, there was a referred an additional 117 during that time. We released 117 during that time frame. Our average daily population was 9 and an average length of stay of 9 days. We had an average of 19 juveniles that were taking some form of psychotropic medication in our detention facilities. Just a brief update on the ADA suicide renovations going on out here. There's been some delays. TJ may be able to speak more on that, but the pandemic has caused some delays with the manufacturer and transportation on getting some supplies, getting some of the fixtures and everything out here in order to get that completed. We currently have 9 juveniles in our detention facility. So far during the pandemic, we've seen a lower than average number of referrals come through our detention facility. which has been very beneficial. We've, during that, starting it out in April until present, we've had a total of 73 come through our detention facility. Gives us an average daily population of 8 and an average length of stay of 9. We put precautions in place as far specific to COVID-19. We put precautions in place back in March, mid to late March. And those were based off of some procedures that had been put in place at other facilities that had been recommended in one way or the other by either CDC or by health department. That includes, proper sanitation, temping the employees, specifically back in our facilities, giving them a temperature reading when they showed up for work, routinely doing temperature readings on juveniles throughout the day, quarantining the new juveniles that came in for up to 14 days, social distancing, not only with juveniles, but to employees. Keep in mind, as much as we can, that's not always possible. Staying on top of the employees, making sure that they're not coming in with any of these symptoms. We have a great nursing unit here who has been very active in helping and staying on top of the juveniles' welfare out here and making sure that if any symptoms are detected, that they're handling that according to whatever rules, regulations, processes are in place for this particular virus. So with that being said, I'd be more than happy to answer any questions from the court.
Okay, yeah, any questions anyone would have?
Just, is your staffing holding up well, Colin?
Our population has been lower than normal. And so long story short, Commissioner, yes, my staffing has taken some hits. I'm sure Amanda may go into that a little bit later on the number of employees that have been able to take COVID leave or the FARCA leave. But we're staying within ratio. We will stay within ratio. We will follow all the state mandates as far as the staffing ratios for juvenile to staff ratio. So I want to assure the court that we will not go underneath the mandated ratios.
Thank you.
Good. And I toured the facility last week. Thank you for the tour that.
Thank you for coming out.
Yes, you and Mr. Vines gave me. It's if you'd like to go out and look at it sometime, call Dr. Coker, Colin Coker and schedule it. They really run a good outfit and can show you a little bit about the ADA things that are happening and where they are with the project. It's right now challenged with disruption from the COVID-19. But
and we appreciate you coming out, Your Honor. I appreciate your kind words. And I also want to thank the Commissioners Court for allowing us to move forward with those anti-ligature fixtures out here. Very, very needed. We appreciate that immensely.
Okay. Any questions? All right. Is there a motion to approve the report for recording purposes?
So moved.
Second.
Got a motion and a second. Any other discussion? No other discussion, call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller, Judge Felton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. Thank you. Thank you, sir.
Thank you. Thank you, Your Honor. Thank you, Commissioners.
All right. Going to item D2 is engineering monthly activity report from March through June of 2020. Morning, Zane.
Morning, Judge, Commissioners. My report, I'll try to be as brief as possible because I know we're running out of time. The roadway projects are going well. 2 of the roadways, Surrey Ridge and Ritchie Road, are substantially complete. Eagleville is going well. It's under construction now. Chapel Road is still in design. We had 3 off-system, TxDOT off-system bridges completed during this past quarter. That would be Bays Road and Precinct 2, Chisholm Trail Road, at Hog Creek Precinct 4 and Compton School Road at Hog Creek Precinct 4. We do have other bridges that are going to need some engineering design work. And so whenever we get into the budgeting process, I'll need to bring that up again so we can budget for some additional engineering bridge work. Cow Bayou's watershed flood control structures, otherwise known as dams, they have been going very well. We've actually got over $250,000 in grant money from the State Soil and Water Conservation District. And we have been applying that for O&M activities to clean those dams up. And that's been going very well. As far as COVID-19, we put up a glass wall for some of the staff, and we're still trying to get some more glass wall put up for additional staff. We've got plenty of mask and sanitizer and cleaning from time to time to keep everything clean, and so that's going well as well. I don't have any needs at this point in time other than future need for funding for bridge engineering and in the next fiscal year.
Okay. Thank you. Any questions? Okay, thank you very much. Is there a motion to approve Dane's report for recording purposes?
Motion to approve.
Is there a second?
Second.
Motion made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller, Judge Felton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. Thank you, sir. Okay, under D3 is County Veteran Service Officer monthly report. I don't know if Steve Hernandez is on the call or not. Apparently not. You got the report pardon me? Okay. Morning, Steve. I guess that's you. I can't see your face very well. Oh, there you go. All right.
You see,
You're
Steve, I
mute.
think you're on mute.
I am on mute.
You're not.
Oh, don't.
I'm trying to, it keeps kicking me back to mute.
Okay, we hear you.
Okay, good. Okay. Good morning, everyone. It's been a while since I guess we've seen each other, but I guess the Veteran Service Office, we're still in business. We still, the staffing's good. The challenges, of course, are the fact that the VA regional office is closed for public contact. So we're kind of getting some calls and some people show up over there, and we're having to kind of tell them, unless they're in the county, we really would prefer not to talk to them unless over the phone. So we've been trying to handle some issues there. Same as Social Security office. We're getting some overflow there. They're coming over. I don't know if they're getting referred or what, but any Social Security issues, we're also kind of find ourselves calling in. We do have some inside numbers that we call and get some, at least get some feedback from Social Security on what to do and how to do it. But they have changed. There is a number they can call, and they will schedule an appointment for them. So that was a good thing. The regional office was supposed to open for public contact this July 6th, but because of the spike, they're not going to be open again. And TVC is also kind of working from home, Texas Veterans Commission. So we kind of have a little bit of an overflow there. I don't know how it's happened, but everyone seems to think that since we're open, we can just see anybody. And we're really being pretty restricted on who we allow in. Since it's an MHMR building, we're adhering to the MHMR guidelines. What they do is we have to have an appointment. When they come to the parking lot, they call, then we go out and get them, or they come in and they immediately get a temperature screening. And then from there, we do meet in a conference room, and we are masked, and they are masked also. And if we have to do a person-to-person meeting, we do that. I know the acute psych, the hospital is also on a pretty much a lockdown. It's pretty strict in getting in. So we have been having some I guess a little bit of hindrance getting people into acute psych. We've been getting some calls for veterans that need to go to acute psych and have been trying to get us to try to mediate that for that transition. And it's been a little bit challenging because like I said, the restrictions that are on the hospital, we just don't have any control over. And there's some frustration over that.
Steve?
Yes, sir.
It looks like the majority, according to your reports, the majority of what you do is handle claims. How's
Yes, sir.
claims processing going?
We're still doing okay, Judge. We're doing a lot of them over the phone. We're trying to handle it over the phone. We're doing emails. The only time that we really kind of get directly involved is when the fax takes place. What it is all the VA claims go to a intake center in Janesville, Wisconsin.
Are they slower, or are they about on the same amount of time turnaround? Or
No, I was going to get to that. Yes, sir. They are getting slowed. It is going to be a backlog issue, and I think it's probably going to make national news eventually. But yes, it is. They are getting backlogged with examinations for compensation and pension exams, and the actual decisioning is starting to lag a little bit on that. Same as anyone that needs a separation paper when they get out of the service, if they lose theirs. It's called a DD Form 214. The National Personnel Records Center in St. Louis is also not being very responsive right now. They're just taking priorities of a homeless veteran, a veteran that needs emergency surgery, or a veteran that has passed. So that's been, like I said, it's more from the federal level that we've been having some issues and trying to make sure that we can keep everything going. But as far as the claims, we just send them all through fax to the Janesville office. And then from there, we give the veteran a confirmation, and that they have a unique fax ID number that in the event that something happens, they can always refer to that. So we've been kind of getting those in as they come in. But as far as walk-ins, we've been kind of limiting those. Staffing's good. Jail visits have been minimized right now. And the home visits, veteran home visits and nursing home visits have also, well, of course, the nursing homes can't do anything other than we've just been getting some donations for food. And we've been kind of sharing them with some of the nursing homes that we've been able to give out any of the donations that come in. So, but other than that, that's we're going to be all right.
Okay, thank you. Any questions for Steve? Okay, thank you, Steve. Is there
Yes,
a
sir.
motion to approve Steve's report for recording purposes?
Motion to approve.
Is there a second? I think Commissioner Snell second.
Second.
Okay. Okay, any other discussion? No other discussion, call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller,
Aye.
Judge Bolton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Pass. Thank you.
Yes, sir.
Going to item D4 is purchasing monthly activity report. Ken?
Yes, sir. I'll just point out a few things. I wanted to say, of course, the court knows that we have received the RFPs or proposals for the McLennan County Insurance Committee has been meeting regularly. We've had presentations by some of those people that responded. We've also have set up demos to see their open enrollment systems, and we've been reviewing those. We're coming very close to having a recommendation that we can present to the court. But just to say, we're still working on it, and we'll probably have some other meetings to set up.
Okay.
Also, too, just to share with court, we did get out the RFP for the asbestos abatement and demolition in the old downtown jail. We have a pre-bid meeting next Thursday where we'll walk them through the jail and high five. And we've been getting quite a bit of interest in that. I'm getting emails regularly on people that want to attend that walkthrough.
Okay.
On another thing that's coming up, I've set in on the power pool conference calls set up for the Tuesdays each month, and it looks like they are getting ready to go back out for bid for electric services from 2023 forward. They haven't set an end date yet. They've talked about anywhere from 3 years, I think, possibly up to 10, but that hadn't been said. I'm just saying that's where we're at. We continue to work with TJ on janitorial services, and in that light, I mean sanitation services, or excuse me, disinfecting services. So we've got that going on. We are working on trying to get to a stable point on the tower projects. We've all kind of worked together trying to get everything to continue going. With Wayne leaving, there was some things kind of in idle that I'm following up on and making sure that we're continuing forward and not sitting still. I will say this too. I mean, I know there's a lot of people concerned, but we have daily meetings on how much more of the personal protective equipment supplies that we need for what's going on. We take a look at our face masks and our hand sanitizer, and now we need a disinfecting solution. And in purchasing and maintenance, TJ, we all kind of work together to try to make sure that we have what we need. We have a lot of future bids or considerations coming up. Some of them may be renewals, but we'll be taking a look at, like inmate telephones and pharmaceuticals for the jail. We are, as you may know, we're working on a bid for the ADA remodel for the MHMR.
Right.
We actually need to look at jail medical services and the transportation of deceased for chemical analysis, and pauper burials, cremations, and so forth. But we also, too, got a big surprise in the email the other day. We got a written bid for water meters for Elmont. I don't know if you recall, but we worked together to put together a team to do a grant application for Elmont water supply. And this is the engineering firm that came out of, as a result of that, sent us an outline of a bid, and we're working through that to make it a McLennan County bid for that service.
Okay.
Other than that, that's pretty much my report.
Okay. Any questions for Ken? If not, is there a motion to approve his report for recording purposes?
Motion to approve.
Second.
Motion been made and second. Any other discussion? No other discussion. Call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
All right. Pass. Okay, next is under D5's Information Technology, a monthly activity report from March through May. This is a very detailed report. I tried to go through some of it, but I got report fatigue going through it. So anyhow, Lisa, if you could boil it down to the basics.
I'll try to do that, sir. Sorry, it was so lengthy. To start with the COVID pandemic and how that impacted IT, I would say that coming into March, that has definitely taken a great deal of our support focus since that time. Initially, we came in and had to do assessments, team meetings to look at our resources and how we could support our offices, in their ability to, meet their business needs. We looked at our loaner inventory. We made a contingency plan for our office. We reached out to other offices, took the feedback that we got, made arrangements to prep our loaner equipment. We borrowed from HR, and we were initially able to meet, the immediate needs. We went on to order additional equipment as communications came in. We did encounter issues with ordering. There were delays on all manner of equipment. As you can imagine, in this time, everybody's trying to solve for the same needs. Webcams were very difficult, all mobile devices to lay our hands on. In addition to our normal resources for equipment, we source locally as well in some instances, and we're able to fill that. We've had to evaluate the various online meeting platforms for our offices, so that we could evaluate those for the different needs in those offices. Zoom ended up being one of our primary meeting platforms. We assisted many courts in building their meeting templates and did training for them, for all number of offices. That took a little while to get everyone up and going to get our people around, but our offices and courts are doing very well on those products. We also had to work with integration to the video conferencing equipment at the jail, work through some troubleshooting efforts there. All that seems to be working pretty well. So very, very pleased with how that occurred. I'd say our most trying environment is the commissioner's courtroom. We've talked about this a few times. The existing sound system, we've got some issues there that we are working with. I've got more details on that coming up in G2. I've got Tim here with me who's got some information, so I'll just move on from that. Also during this time, in addition to the cybersecurity focus that we had in wrapping that up, as everyone knows, we had 100% compliance. I want to thank all those departments that were receptive to us in meeting that requirement. We also are doing security risk assessment and business impact analysis for our department, where we are evaluating all of our systems, identifying those that are most critical. We are evaluating the various security categories to see how we are maturing in our security posture here, and identifying where improvements, that we're still working towards, and how to phase in those implementations. So very busy with that. We've also taken this time to go through some security maintenance in various areas, revisiting our group policy, firewall configurations, looking at network efficiency, measures that we can take. So a lot of progress there with our team. Also along the line of security, we had our DIR sponsored elections security assessment that occurred on May 19th and 20th. There was some preparatory work that we did with elections and meeting with that vendor to go through the process. Our final report was delivered mid-June. We are preparing an overview report to deliver to Commissioner's Court in the coming weeks. Also assessments, IT assessments for the entire county has been a big focus during this period. You know, it was kind of on again, off again with all the support interruptions that we had, but we did finally manage to get that wrapped up. We've met with the auditor. Adjustments have been made as some of our offices are doing pre-orders to help offset some of that cost. So we're grateful for that as well. We've had a number of projects that we did. I won't go through all of those. I will say that the email, getting that server upgrade going was a very large project for us, and we're glad to have that implemented. EDOC, there's a lot of movement going on there. I'll just very quickly touch on that. We had a JP update, but we continue to have changes coming in for the e-filing project. We've got form creation going on in Constable. The DA's office is, we've been assisting with batch updates. We've got some upcoming meetings, hopefully plan to continue work needed there. The pretrial office has got testing underway for one of their new applications. SO and district clerk have some pending updates. They have testing underway in their offices. So that's kind of as much in a nutshell as I can give you for the IT side of things. Well, our phone refresh, that's going very well. We are, by the end of this week, we should be at 50% deployment on those phone refreshes. And recently met with the space meeting or the space group, and it appears our Cobb's location should be getting some movement soon. I've also invited Claire here with me today. There was some interest in what is going on in the archives area. We've got a couple of big items there. The implementation of our InfoLinks project, which is where they are introducing a new barcoded inventory system. IT and archives has worked together on this project. I'm gonna let Claire kind of walk you through that. And then there were some questions about how we're managing growth in this space. Claire, if you would like to step in.
Hello. Okay, so basically we started in March with the implementation of the InfoLinks barcoding system. We had to review a bunch of data that had to be imported in determining how the organization and the file information would be put into the system. We've assigned names to every room in the archives building, and I would like to note that each current commissioner and the judge have a room named after them at the archives, just as an appreciation for allowing us to get the InfoLinks barcoding system. It's going to be very helpful in keeping up with inventory as well as keeping up with destruction.
We got the bathroom.
We've worked with IT to prepare all the state library retention schedules and get them imported into the InfoLinks system. And we are, I believe, now live with the system. We do start training tomorrow. We've got 8 hours of remote training, and we'll do it an hour at a time starting tomorrow. So it's looking really good. We've got all the shelving barcoded, all of the rooms named, and we've already started barcoding some of the boxes, and starting to look really, it's an easy, user-friendly system, and it's going to work out really well for the archives. So that is InfoLinks.
Did you want to touch on how the other offices would be able to engage with you on checking files in and out with this product?
Yes, so each department is going to have access to their system where they can go online and report and request anything they need through the system. We'll just print it out on a ticket, pull it, take it. We scan the items out with the barcoding scanner and are able to communicate with them through the system rather than phone calls and taking down notes of what they would like to request.
That's good.
So, yes,
nice
it's going to be a nice system. So yeah, we're looking forward to it. It's going to take a while to get all of our records barcoded, but we're working on it.
I would definitely say that this is going to be a project that goes on and on to accomplish that. But I greatly appreciate this team for taking that task on.
Yes. So far as the shredding goes, that's probably been what's hit us the hardest as far as COVID-19 goes, because we've lost the inmate work crew, and that's who does all of our moving of boxes to the designated shredding areas. I've got approximately 300 boxes in the shredding area right now, and the shredding company comes today to pick up 100 each week until we run out. I've got about 1,000 boxes marked throughout the building that need to be put into the shredding area, but I don't have the work crew, so we've been looking at, we've contacted a couple of different companies, and they're supposed to get back with me and meet with me to see if they can come over and maybe scout out what needs to be done and maybe what the cost would be, and then we would have to see about getting them CJIS certifications. But that's, as far as movement of the shredding, we need work crew. So that's been our biggest impact.
We'd be looking like at a moving company that
Yes.
knows how to move things like that.
Yeah, after they do the movement of the boxes, we'll still have plenty to do. They need to move some shelving around. Since the construction with the IHC department moving into the building, we've had to rearrange some of our shelving. And once some of our construction happens in the archive side of the building, we'll be able to rearrange some of the shelving to create more room for anything coming in. Our biggest space is going to be contingent upon the relocation of the mobile shelving units and the district clerk's files. Once those are relocated, we'll free up enough space for approximately 13,000 boxes. So that's going to be a huge relief on our back. It'll free up a lot of space for us. So.
And in that space, you would need to purchase new shelving, I believe.
The standard shelving that we had there beforehand, and it's not very expensive, and it's not something that we would have to get all of it at once. I think we could just do a little bit at a time. With each budget, we could do, like a few $1,000s per budget to create more shelving in that space, because we utilized what was there down in the basement.
And then, of course, this is contingent on when they are able to get that space ready for the district clerk's office and move that. So we had, again, recent discussions with the space group on what that looks like. So I know there's some movement there, and, so all of these changes, come behind that.
And we've also discussed with the district attorney about possibly reducing the redundancy of paperwork that goes into the files, and as well as possibly having them scanning cases as they're closed, so that we can close the gap between how much we have still to scan and what they would be able to scan as the current year.
So as an example, Claire, this year you guys just digitized, what year was that, 1998?
98 felony files, yes.
Yes. So in meeting with the DA's office, they were very cooperative at the thought of starting that digitization on their side. They're handling all the paperwork anyway. And what they suggested is at case closing, they could go ahead and filter through all the stuff that normally is received by archives, weeding out all the replicated information, unnecessary information, getting those images into the system. And then essentially, as we digitize the older material, we'll eventually close that gap. But right now we're only doing 1 year each year. So this, of course, would take a very long time to catch up. So one of the things that we'll want to bring up during budget time is maybe being more aggressive about getting that digitized and closing that gap sooner. There'll just be a lot of things to be considered. As an example too, Claire, I think you told me you had 50 boxes in the 1998
felonies, yes.
Dispositions. And what did that look like most recently in 2019?
2019, we received approximately 175 boxes of felonies, as opposed to our 98 is what we just finished, and there were only 50 boxes. So as the years go on, it's going to be more and more boxes.
Yeah,
more cases.
And I think the year that we had the Twin Peaks, that was, of course, an exceptionally large year as well that we'll run into at some point. But the other nice thing is the DA's office is considering changing the retention for some of these records as well, which will help us remove some of those out of the the circulation that we have currently. The bulk of these are what, 20 years? Is that right, Claire? With the exception of capital murder?
Yes, the hard copies are kept for 20 years when it comes to felonies. The
And-
capital murders we keep permanently, hard copies and microfilm.
So the DA is suggesting they would continue to keep any murder or sexual crimes the 20 years, and then all other
All
felonies,
other felonies could be kept for only 10 years.
10 years. So that should
That'll help
a great deal.
reduce.
And they would be willing to give us some of their staff to help us get that, I guess, work through that paperwork with Claire's team. So if you are interested, they are happy to come to court to speak to any of this. They told us that we could put that out there if you'd like to invite them for further discussion. I think that covers kind of the digitization area. Oh, the cost on that too, by the way, those 50 boxes this year cost us approximately $16,000, I believe. Is that correct, Claire?
Correct.
Yeah.
Yes.
So it's not inexpensive to have that done, but just want to get that on your radar for budget discussion.
Okay, and of course, the main goal is to get a lot more useful life out of the archive building, which I think we're getting there. It's not without cost for sure.
Yeah.
But appreciate all the hard work and the planning, and appreciate the Space Committee for working and assisting in that as well.
Absolutely.
The other thing, Lisa, the cyber training, we finally got it all done.
Yes, sir.
It-
100%.
So, and I'm assuming that's something that we would do every year, or you'd have to because things change.
Yes, sir. Technically, we're in the new year, but we felt it might be frowned on if we turned around and opened the new training right away. So we're giving everybody a little bit of a break. But we would.
You're
What's
correct
that?
in your assessment of that. So,
Yes. So we're trying to give a little bit of a break, but Brandon and I will be back around at some point to introduce a new training period with, and hopefully we'll have people finish ahead of time instead of, so close to the closing of the training period. I am happy to report that there is some new training material in the library. So it won't be a repeat of the same material, probably the same message, but at least new material to look at.
well, it not only provides protection for
Thank you.
for the county, but also for people as individuals, our employees. And, yesterday, there was a cyber crime trying to be committed on my wife's phone. So she didn't fall for it, but the training has helped employees. handle
Yes,
it.
I will say we get a lot of good feedback from the staff saying that they're able to take that knowledge home to their families and help their kids and their spouses learn how to protect themselves. And a lot of the departments are reaching out to Brandon, taking advantage of having someone on staff that is dedicated to that function. So very, very happy to see that relationship building.
Okay, anything else?
Other than, I think that really covers everything. We are hopefully, we're looking forward to getting a door system, access controls over in the archives too. That was the second thing we discussed in our space meeting. So we look forward to that improvement as well. But I think that covers everything other than the Commissioner's courtroom, and we will wait for that agenda item, G2, I believe.
Yeah, we'll get that in a minute.
Okay, thank you, sir.
Any questions for Lisa?
Motion to approve.
Have a motion, is there a second?
Second.
There's a motion and a second, any other discussion? No discussion, call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. Thank you.
Thanks.
Next is mental health court services monthly activity report. It's been fairly stable. A few blips up in the mental health side. On probate, we've done 378 probates in this budget year. And, we still struggle with trying to find places on mental health folks to send them to state hospitals and others around. It's always a challenge on that. But other than that, Karen Rose in her first year of in that position of probate clerk and really doing a good job. And Mary's got a good handle on the mental health side. The Office of Court Administration has put in certain guidelines for hearings that include but not limited to mental health hearings as well as probate court hearings. And so we're doing all of our probates through virtual. There's no one that comes in the office, and we cannot expand that until after July, I believe either the 6th or the 9th. But at that point, we possibly would have some people coming into the courthouse, but I don't look for much as long as we can do it by virtual. Most of our clients would rather do it that way. It saves them from traveling. And many of them are not from Waco. They're from out of town, but their parent or someone here that passed is this is the venue for probating. So I think that's something that all the courts are being able to do that probably won't go away. So any questions anyone have about that? If not, is there a motion to approve that report for recording purposes?
Motion to approve.
Is there a second?
Second.
Motion been made and second. Any other discussion? No discussion, call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller,
Aye.
Judge Bolton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. Going to item D7 is maintenance of buildings quarterly activity report for June. TJ, good morning.
Good morning. How is everybody?
Everybody's good.
Good. So same basic report that we usually see every quarter. Projects are going really well. As Colin had mentioned earlier, we're running into some delays on the anti-ligature and plumbing parts for juvenile. I think they're scheduled to hit sometime in late July, which we weren't expecting. So that's putting us behind a month and a half. But it's kind of one of those things that we're starting to get used to with the COVID related stuff. Other than that, the other projects are going well. Got a few little things to finish up out the garage to get them fully accessed and utilizing the tire shop. The other projects are going well. We've had quite a few large maintenance repairs on various items throughout the county. Our biggest hurdle right now, of course, is just the COVID and getting things up to speed for the court systems opening back up next week. So we've gone through and we've put in all the necessary implementations for hand sanitizer units, sneeze guard systems. We've made sure the sheriff's department has all their masks that they need, all the available signage. So I think we're in good shape. I don't expect us to run into any giant hurdles as far as that's related. Other than that, it's business as usual for us.
Okay. All right. The fact that we don't have inmate crews working, is that causing you much issues?
Well, yes, of course. I mean, we're seeing quite a bit of slowdown project wise just because we don't have the manpower necessary to do some of the things that we need to, as well as on the cleaning side of things. So, we discussed in court the last time about bringing in some subcontractors to help with the sanitization of the courtrooms. So we'll see those guys. They'll come in next Monday. We'll have 6 additional staff members at the courthouse, and we'll have 1 at juvenile and 1 at 4D court. So they'll help us with our day-to-day issues as far as custodial is concerned, as well as the sanitization of the courtrooms.
Well, they have some kind of identifying apparel on or a hang tag or anything like that. Have you thought about that?
I'll touch base with them. If they don't have anything that's company related, then we'll definitely issue them a badge that they can wear that'll have their name. And then I'll go through and introduce them to the different court reporters and court administrators. That way they can stay in contact throughout the day to know when hearings are over with. That way they can come in and do the sanitization and keep going throughout the day.
All right. Any questions for TJ? Seeing none, is there a motion to approve TJ's report for recording purposes?
So moved.
Second.
Motion made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller,
Aye.
Judge Bolton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. Under item D8 is Health Benefits Plan Manager Quarterly Activity Report for June 2020. Rosemary?
Good morning. Nice to see everybody today. My report's kind of short and concise, but there's been a lot of work with the insurance committee in preparing the RFP for our health services and ancillary providers. We are continuing meetings and discussions, and so that's been probably the main focus of my energy for the last couple of months. I did participate in the meetings over COVID-19 through the health department, the EOC, a limited amount with HOTRAC, of which I am a board member. I've worked a TAC grant. We're about to wrap that up, a grant for road and bridge and building maintenance. And the online training that was required was completed. And just a side note, I have not come to court to request doing a health fair because it would be totally impossible to do one right now. So that usually is in the month of June, but not this year.
Right. Okay, any questions? All right, is there a motion to approve Rosemary's report for recording purposes?
So moved.
Is there a second? Motion been made and second. Any other discussion? No other, Commissioner Jones, did you have?
Second.
Okay.
I didn't hear.
Any other, if there's no questions, call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller,
Aye.
Judge Bolton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. Under D9, Health Services Monthly Activity Report for April, Heather Travers. Good
Hello,
morning.
Judge. Commissioners, can you hear me?
Yes, ma'am.
Okay, so I've really just spent this last quarter kind of getting, acquainted and acclimated to the program, the staff, the county, our partners in the community, and we've been networking. We've made contact with over 20 additional organizations in the community, just re-educating about the program, eligibility criteria, providing handouts and tangible material when requested that can be then given to folks in the community that frequent these organizations. I've read some journal articles and just try to identify that target population and how we can reach them, and so that's kind of driven how we've connected with organizations in the community. Met with Ebony Brooks, the director of Bell County. She actually came here and spent a couple of hours. We shared information about programs. She shared some information about a transportation policy program that they had in their county, which is very interesting to me. And I plan to visit with you all some more about that moving into FY21. Met with Brent at the Lakeshore Funeral Home. He actually invited our whole program to come out and do a tour of the facility, a meet and greet with all the staff. It was great. He's just been a pleasure to work with. I'm sorry.
Good.
Met with Francis and Haley from the auditor's office. We kind of went through some processes as they pertain to how we process bills here and reimbursements. We've changed a few of our processes to make things easier on their end. And then I think that's going to help with how I'm reporting data on this end as well. I won't go into too much of that detail unless you have some specific questions about it. Attended the quarterly McLennan County Health Board meeting. That was my first meeting. That's one of the boards that I guess you've all determined that I will serve on. Had an introduction meeting facilitated by Dustin with Gina Adler at Providence, and Richard Perkins at Hillcrest. So I'm still just, because of the COVID, it's kind of made this starting process a little different. So I'm slowly meeting everybody and getting adjusted to the roles that we have here within the program. On a program level, specifically here, we've restructured some job duties to accommodate the workflow procedures and to better suit the job descriptions that people had originally. I think that things had gotten a little off track and people were doing a couple of other job duties. So we just took a look at that and kind of went back to the basics and restructured some things, and it's working great. We've completed a standard operations procedure manual, which is terrific. So now everything that's in our brain is on paper. So if somebody's not here, we can simply pick up that manual and take a look and find out what we need to be doing. We're also doing cross training so that there's more than one person that knows how to do everything within the office. We've welcomed a new eligibility specialist, and we promoted an eligibility specialist to our lead role. And it was a staff that's celebrating their 18th year here. So I was excited about that.
Good.
Currently working on written policy specific to the program. We have the handbook, that's the Indigent Healthcare Handbook, that's the state, but I'm working on getting something tangibly written that has all the addendums in it for the stuff that we've approved on the county level thus far in the program. I'm working on going back and looking at previous agenda items and meetings and things and trying to piecemeal that together so that we have something tangible on that as well. We're working on improving our website, adding some links, some forms. I've looked at other counties and we've just kind of gotten an idea. Ours is great, but I think we have room for improvement. We're researching barriers to program enrollment. Our numbers keep going down. I have a few theories about that. But in addition to just the basic COVID stuff that's going on and people, shelter in place and all that, I think that we have some actual barriers to successful program enrollment. And we can look at all of that FY21. We're continuing to network with our community partners. It all looks different now. Generally, we just show up, shake hands, and talk. Everything's done by Zoom. And so it's just looking a little different. So I plan to kind of hit the ground running, and then, we're in the middle of a pandemic. So our current COVID precautions, back when we had shelter in place, we were only allowing one client at a time in the lobby, and we were seeing them through our lobby glassed area. Our case manager was sitting behind the glass, the client was on the other side. And then after shelter in place, TJ's group was really great about getting us the shields done right away for our desk. And so each case manager has a shield on their desk, and we're also requiring all clients that enter the building to wear a mask. If the client is uncomfortable with the case manager not wearing a mask, they're honoring that and wearing one also. So we have mask and the shield, but depending on, how things go, we might get back to just the one client at a time in the lobby. That just limits the amount of exposure that the staff have to potential folks coming in. Looking at our numbers, I know June wasn't plugged in there when you got this report. I've since plugged June in. I apologize, you don't have that. But averaging before, we were seeing about 150 folks a month coming through the door. And then this quarter, that's kind of dropped to less than 90. And a lot of that is contributed to April, the shelter in place month. People just were not out moving around. I think that's about all I have. Do you have any questions?
Any questions anyone would have? What was some of the takeaways from the Belton meeting that you thought might be beneficial for McLennan County?
Well, they had, and I'm still trying to wrap my brain around all of these supplemental programs, but they had a transportation policy in place, but it was funded through one of the programs, and I don't have it in front of me right now. I want to say the DSRIP. It was a partnership with Scott and White there, so it was equally funded. So they had what were called navigation specialists that actually kind of took on additional case management, but because it was a partnership with the county, they weren't just advocating and working specifically for indigent healthcare. Take all of that away. What I liked about that program is the fact that they offer transportation vouchers. And so I think that that's something, I'm working on putting a proposal together for FY21 that I think would be beneficial in our community is transportation. When you think of the indigent population, they don't have transportation. Right. And so we're expecting them to show up to these appointments, bring in this paperwork. And so I liked that they had that program. They've lost it. They've since lost funding for it. And she said that she can tell in the program how much it's hurt as a result of not having those transportation vouchers. We've been doing research on what it would cost here, and she sent me some figures on what it cost their program. And I think for the amount of money that we would spend, the return on it's great. So that's kind of one of the main things that I took away from their program. They have some different funding stuff going on right now, a new commissioner panel. They've lost some funding. It's been redirected to their jail medical. So they have some barriers that they're jumping over right now. So the only thing that I felt like I pulled out of that was beneficial for our county is that previous transportation program that they had.
Okay, I know that both the transportation, intercity transportation and rural transportation has very strict protocols on being able to keep people safe while moving them and getting them to their destinations. And transportation is one of the keys on the indigent health side.
Mm-hmm.
And so I'd be very interested in looking at different ways of funding that.
Yes, sir.
One of the problems at the transportation side is they can't put very many people on a bus or and of course they use sedans as well, but
Mm-hmm.
they've got a pretty in-depth guideline to keep people safe and traveling. So.
And then the rural transit, the way that works is if you're in the rural areas, well, then I think it's a $3 ticket to get from your rural area to Waco. And then you have to get on the Waco transit to go within Waco, which is another $3 or $4, and then $3 back out to your county. Right. So it is a tad bit complicated, but I think if we came up with some good guidelines for how we used it, I think it would be very beneficial to keep people enrolled in the program and to keep them proactive with their health care so that they're not waiting until things get really bad and they're showing up in the emergency room.
Right. Okay, any questions for Heather?
Yes. Heather, your total active clients is down to 206.
Yes.
What do you attribute that to? Is that just not as many people coming in?
Yes. So currently right now it's 204. As of today, it's 204. And what we've noticed is that, you renew every 6 months generally. So those folks that were up for renewal during shelter in place didn't renew. And so we've seen this huge chunk of folks just fall off. And what you have to keep in mind too is that a lot of times their medications are on 90-day refills. So what we're seeing now is when they're going to fill that refill, then they're calling and saying, hey, I need to renew my benefits. So they kind of let themselves fall off the program during that shelter in place period. And then now when they're running out of meds or it's time to go back for their follow-up, they're realizing I've lost my benefits and I need to reapply. So we're seeing some of those come back.
So is any of the funding for this directly related to total numbers and things like that?
Not that, from what I understand with the budget and visiting with Francis Moore and trying to get a good idea of how our budget is funded, no, I do not think it's directly related to number of enrollment. And I've been working on some stats for that for FY21 to present as well.
It's a per person in the county.
Yeah, so each person enrolled in the program gets up to $30,000 worth of indigent health care benefits for a year. Does that make sense?
Yes. Okay. Thank you.
Heather, do we know how many individuals were affected? Ooh, excuse me. Do we know how many individuals were affected by that time crunch where they should have come in and been renewed, but they were either sheltered in place or they just haven't come out because of COVID? Do we know how many people?
About 75. Just looking at the numbers for that month period of the ones that should have renewed that we haven't seen come back and renew. And so keep in mind, we mailed them a renewal packet and they can simply mail in the information to renew. They don't even have to physically come to the office. But you have to keep in mind too that a lot of these folks don't have a stamped envelope laying around the house. So one of the things that I'd like to propose, again, FY21 moving forward, is that when we mail out those packets, could we simply put a return, envelope in there that just gives them the ability then to maybe stuff that information and shoot it back to us, because it's simple little things that are causing folks to not be successful, if that makes sense.
It does. When you say the number 75, so we lost almost a third.
Mm-hmm.
of that client base?
Yes, ma'am.
Hmm.
And we've never shut the door. The door to this facility and this program has never shut. We've remained open. We've taken precautions, but we've not turned anyone away. They're just not coming in. One of the things I think is happening, and I don't have anything to legitimately prove this, but I think that the Medicaid guidelines have widened. So I think some folks during this have maybe been eligible for Medicaid where they haven't in the past, because I think that eligibility criteria for Medicaid and food stamps and things has broadened. So I think that that might be some of it, but the majority of it, I think they've just not come in to renew.
Okay. I won't prolong our department head reports. I'm going to visit with you more later, but I would like to say thank you for your approach to the department and the initiatives that you're putting in place. I know sitting in on a call that one of the concerns the medical community has is that individuals during COVID, but they have those underlying conditions that they will not continue to seek their medical care. And they're really stressing that people continue with their ongoing medical care even during COVID. But I'll visit more, but I'd just like to publicly say thank you.
Thank you. Appreciate that.
Okay, thank you.
Welcome.
Any other questions for Heather? If not, is there a motion to approve for recording purposes?
So moved.
Second.
Motion been made and second. Any other discussion? No discussion, call for a vote.
Commissioner Snell, Commissioner Miller,
Aye.
Judge Bolton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. Next is D10, pretrial services monthly activity report. Is Judge Bain or Kathy Edwards on the line? Is there anything on the report that anyone needs more explanation on? If not, you have the report, and I'd entertain a motion to approve for recording purposes.
So moved.
We have a motion. Is there a second? I'll second. Any other discussion? No other discussion, call for a vote.
Commissioner Snell, Commissioner Miller,
Aye.
Judge Bolton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Passed. I'd like to hold HR's report and go to item D12, which is maintenance of equipment, update and activity report, and call on Michael Graham to address the court. Good morning. How are y'all? Do we need to get another microphone? No, you can't distance. Don't lie here. Michael, welcome to court, and appreciate you taking on that position, handling the garage. So
I officially start over on Monday, so it's been like this a week of learning quickly.
that's enough.
And so trying to get everything going last week, work prayer. Bring your shop up and going. They had a lot of downtime, so they getting moved in. Working up different things, trying to get the tower sites up and going. John is kind of working on that with Ken and trying to fill the gap that they had there. And just waiting on bi-weekly conference calls and making sure things are going there. We should get the shelter, the building set at precinct 2, I believe, in a couple of weeks. We're on to get tired of one out there. Doing a big project right now at Highway 6, jail main control, trying to get some monitors, place that validate, get the things just up and going. next level of the office, physical on facility. And, this week actually installing a cell phone booth at Precinct 4 Road and Bridge. Started that project yesterday. Sign shops are making quite a few signs, make 301 signs from March to June. Very recent, sitting now, Sheriff Austin jail. The garage is somewhat of a going. We're able to do oil changes and tire rotations, things like that. Working with TJ, they're working on finishing the tire shop and doing it. We're going hopefully push them that Saturday to start that project. We'll be talking about tire repairs, still sending out tire repair services. The garage was down from May the 4th to June the 19th, our first oil change that we did. So we had to outsource some services, but we are getting feedback up and going. Kind of where we're at.
Okay.
Any questions?
Any questions anyone have?
We'll save them for next time when you have a little more time on.
Yeah, it was quick trying to get everything going in a week, but
Okay.
we'll make it happen.
Well, if we can help you, please let us know.
Thank you.
All right, thanks. Is there a motion to approve that report for recording purposes?
Motion to approve.
Is there a second?
Second.
Motion been made, second. Any other discussion? No discussion, call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Jones, Commissioner Perry.
Aye.
Pass. Okay, we've got numerous items besides HR's report to go, so if everyone's schedule can accommodate this, I'd like to recess until 1 o'clock and start back and finish up the agenda. Will that work for everybody? Okay, I don't see anybody saying it can't. So we'll recess. It's 11:53, and we will adjourn at 1 o'clock. Whoa, 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 whoa. Okay, go to item F4, Justice of the Peace, Precinct 1, Place 1. I'd like to call on Judge Hensley.
Judge, this is Amanda. I think I'll start, and I think Judge Hensley is going to join for any potential questions that the court may have. This particular item also correlates to item F, Human Resources and Salary Matters 3, Justice of the Peace Precinct 3. Judge Faria is not available to be in attendance this morning, but or afternoon now, but Judge Hensley is available. With regard to this request, during budget time last year, we put a dollar placeholder in a line item for most of our Justice of the Peace offices in the event they needed to fill a position to cover an additional need that they have given a change in kind of their court proceedings that was determined by the Texas legislature. I can't talk, I'm sorry. So Senate Bill 2342 was passed, and in that bill, it is increasing the volume and the ability for the JPs to preside over civil matters that are not more than $20,000 in monetary value. So given that, that is an estimated increase to their operations, and that Senate bill is effective beginning in September. So both Judge Hensley and Judge Faria are requesting the ability to have funds actually amended and adjusted in their budget to allow them to fill these positions so that they can move forward in the hiring process, which takes some time, and also have ability to train that new staff member of their operations so that they are fully operational and ready to handle that volume when this becomes effective as of September. So they would like the ability to immediately proceed in filling these two positions of this fiscal year. They would like to immediately begin to recruit for these positions and provide that training. So what we have done for the court is in our memo to the court, we provided the dollar placeholder for the two line items for JP Precinct 1-1, JP Precinct 3. We put an estimated budget request in there of $36,497. That value was created based on the average salary or average budget line item for all of the JP court clerks. So it's an average figure. We also provided for you in that memo a detail of what each individual JP office court clerk is budgeted for pay so that you could see what those independent budget line item numbers are. So this is a request allowing them to proceed in getting a budget amendment on the agenda to fund their dollar placeholder so they can move forward in recruiting for these positions, training these employees so they are fully functional and operational to address the change that occurs effective September 1 from the Texas legislature. Again, Judge Hensley is available on the line to kind of answer questions that you have related to this item. But it was presented to all of you, spoken about in prior budget sessions, though that was some time ago.
Okay, any questions anyone would have? What's the pleasure of the court?
I have one, just kind of briefly, on the salary for this person. Would this be a new hire, or would this be someone promoted into this position?
So I will answer that question. Ultimately, both Judge Faria and Judge Hensley will defer to the court as to what budget value you provide them. The amount that we provided, again, is an average number based on what all of the JP court clerks are making. So in funding that budget, it possibly would depend on what ultimately is determined for the value of that budget for those dollar placeholders. they may have a situation where they do some internal moves to move an internal employee to this dollar value, at which point then they would backfill that existing position. Ultimately, they are hiring a new employee for that office to address the added volume of operational demand they're going to have given this legislative change.
Okay, and I asked that question because I noticed that there are some employees across these other precincts that earn less than that. And so did you base that salary on the responsibilities of what this new position would do? Or is this simply a number we came up with?
So Commissioner Miller, all of those budgeted values for each of those JP court clerks is within the pay grade range for the position. Again, what we have given you for a budget request is simply an average. The court can decide if they would like to select one of those other current budget values for funding of this role.
I guess what I'm asking that I need for consideration is, did you align it with any responsibilities? I'm trying to figure out how we ascertain this amount. Is it aligned with the functions and duties of what this position would do?
Yes, the job description, the position requirements, the position analysis is paired exactly with that of all the other JP court clerks. Yes, there is a variance in some of the budgetary values among these JP court clerks, but based on the position pay grade, all of those values are within the pay grade range of the position, as is the duties and responsibilities for the new positions they're requesting to begin hiring for.
Okay, because I'm just trying to look for a roadmap since we have two positions. One's at 35,000. That's across precincts, and another position is at 33,000 across precincts. So I was looking for a roadmap in regards to approving the salary on this one.
Amanda.
So currently JP 1-1 has a JP court clerk at $35,937. If you want to match that exactly, you certainly could choose to do that. The JP Precinct 3 has 2 court clerks that are making $35,143. If you want to keep these positions in alignment within the precinct they will exist in, those would be the numbers I would recommend you apply.
Okay, so why wouldn't we take in consideration if this is going to affect all justice of the peace precincts? I noticed that precinct 5, they have 2 positions that make at $33,974, and precinct 2 has a position that's at $33,994. And that's the only reason I asked the question, is how did we come up with that salary? I could see it within the range, but how do we come up with that salary given that there are tenured employees across other precincts that make less? And I was trying to see if we tied that to responsibilities and functions.
Amanda, could I comment to that?
Sure, absolutely.
The volume in my court is substantially higher on civil filings, and that's what we're looking for as a civil filing clerk. Last year we had 2,100 new cases. We have 4,000 pending cases. Most of the other courts in the county are under 500 pending cases. So there's a substantial difference in the volume my clerks are handling, is why I was pushing for the end. But I'll certainly respect whatever the Commissioner's Court decides we need to start at. That's what we'll advertise at. But that is why I asked to go higher, because my clerks are dealing with a lot more volume.
Okay, and I can understand that. I was just trying to get the rationale, because I'm sure if we start adding additional clerks, that everyone's going to ask for. We need to create a position that would be the same across precincts.
I personally would like to see some of those numbers, Diane, that you could provide us. Okay. And do you really think you're going to have that much growth with what we got going on right now? I mean, we're in a crisis for the county that we are going to have to watch every penny that we have for the taxpayer because of the fact so many businesses are closing, so many people are without jobs, and to ask for additional personnel at this time, I just can't support due to the fact that of the stuff that we've got going on. And on top of that, you and the other JP are two of them that aren't doing the magistrate at the jail either. So that's time that you've got extra in your office that you can do more work.
Actually, I have been magistrating during the week, but that's not the issue here. We do expect to see our volume probably double. Although we've had a lull that started with COVID, we were ahead the first 3 months of the year of where we were for 3 months last year. And when the jurisdiction doubles, you can file in our court for, a couple $100. If you file in the county court or upstairs, it costs you several $100s. The majority of our civil filings are debt claim filings. So they're going to go with the cheapest alternative. It's cheaper to file, and we process stuff a lot more quickly because we're able to move the docket. We don't have the other things that they have upstairs. So we do expect to see most of the cases that are under $20,000. Certainly the debt claim cases, I think, will all come down. Small claims cases, they may have a preference for a judge up there if they're familiar with them. But we expect all the small claims cases to migrate to the JPs just because it's cheaper and quicker.
And do you know how many that would be?
Well, I have 4,000 pending cases. I tried to find out how many cases they had upstairs, but I never could sort it out. I went and talked to the district clerk and asked him and they couldn't separate out the small claims from debt claim cases. And that's really where we may see more small claims, but the debt claim cases is what I really expect to see come to us, the debt claim cases that are under 20,000. And I never could get those cases separated out up there, but we had 2,100 basically filed in 2019, and we were at 653 at the end of March this year. So that would have put us way ahead had we not had the COVID. And I don't have any idea how quickly it's going to pick back up. We are getting a lot of filings start coming in now because we have been given permission to start processing debt claim files again. So they are starting to come in boxes again, a dozen at a time.
In the notes I received from Judge Faria, he is anticipating increase of 35 to 40% of civil filings. I don't know how many they currently are processing. That's not in these notes.
One thing to take into consideration is when you have the same job description across in numerous precincts in this case, and we post this one and a higher one, we could actually, I guess you'd call it, cannibalize the other precincts because you're paying more money. And so it could cause someone to say, well, I'm doing the same work. Why don't I apply for that job with Judge Hensley because it pays more money? And so that was one of the reasons we tried to.
Yeah, I can certainly understand that. And I'm comfortable with whatever you think is appropriate to set it for. And actually, I'm thinking we might start with somebody, just maybe 20 hours a week or 20 and see if we can keep up with the volume. Then if we need full time, but Amanda advised me it was better to go ahead and get the position established. And then if I only filled it on a part-time basis, if we found that we actually did double, it would already be ready to go to increase those hours.
Yeah, her point would be that you made sure you already had it in the budget.
Right.
I can understand that, but there may be a way to do both. But in other words, get it approved in the budget full-time at whatever dollar amount we decide, but start out part-time, and it gives you opportunity to test somebody out as well without having long-term.
Well, and we don't know yet. My guess is going to be that it's going to double based on the people I've been talking to who file with us, but we don't know that. We don't know it until it actually kicks into gear. But it does take time to fill the position, and it takes time to train people on the software and the flow.
It does. Well, I would support having it in there at the level of, so we're not drawing from another precinct applicants, and have it as equal if we can get it. I don't know why. I know Commissioner Miller brought up that there's actually some at the 33 level, and so we'll discuss that during the budgeting time. But
okay,
I would support these requests.
And again, Judge, if I may, for the whole court, the information we're providing you is to help you in making your decision of what you wanted to look at as far as funding the budget. Judge Faria, Judge Hensley didn't have a set dollar value in mind. They wanted to heed to the court's discretion on that. So Human Resources simply provided you with what their average pay is for the court clerks and provided you what each individual court clerk is currently making. So you had information at which you could make that decision.
I would like to just interject this, because I'm listening to what Commissioner Snell says, and I agree with the point that, number one, we don't have the responsibilities or the functions of this job. We're not really sure of the amount of workload. So do we just put money in the budget and freeze it in a spot? And we really don't have all of the details around as far as the parameters of the.
I'd be happy to send you the description that I was working off of. I didn't realize you didn't have it, but we have a job description for the clerk. And in my office, everybody cross trains on everything, so it includes a little of everything. This particular position I'm seeing as being primarily civil filings, but we cross train everybody to do everything in the office. So our clerk description describes all of our functions, and I'll be happy to shoot that over to you.
That is true also
is
for
the volume.
Judge Faria's office.
I have a question.
Yeah. Okay. I just wanted to
Go
finish
ahead.
this thought. Maybe we need to do raise your hand. And I appreciate that. I just would follow up with what Commissioner Snell said. Since we don't have the volume and this is a budget crunch, I would be more in support of looking at it as an hourly position and then seeing what is required of the position. But just to your point, Judge, if we're cross-training, I just don't see creating a position that would be equal in responsibilities to other positions, but paid higher, when I really don't anticipate us doing a lot of pay increases going into the budget session, because this is going to be a hard budget cycle to deal with. So I would be if we're going to move ahead and put the position there, I could see it being hourly, but I could not see it going past the 33.9 level. That's all I wanted to say, Commissioner Jones.
I agree with you completely.
Okay.
I'm fine with that. I'm just looking to get a body trained so that if we get swamped, we're ready to handle it, because that's what we expect.
Yeah, I understand. So, someone want to entertain a motion? Commissioner Miller, did you want to put forward a motion?
No, sir, I did not. My thought was, if we went ahead with the position, that would be how I would fund it. But I wasn't moving forward with the position. Sorry.
But
Okay. Well, go ahead, Commissioner.
but you're okay with hourly, with it being hourly?
Yes.
Yeah, as long as, I'm sorry, were you speaking to me? Or to
I was,
Commissioner Miller?
If you speak to me, Commissioner?
yes.
Yes, I can make a motion. I would move that we would implement this clerk position on an hourly basis for precincts 1 and 1. Is it, Judge? Are you 1 and 1?
Yes,
And
1-1.
3?
And three.
So One thing to point out for all of you is if we make this position a part-time position, it would be hourly paid and they'd be limited to not having the employee work more than 30 hours a week, because if we're working an employee 30 hours or more, there would be benefits entitled.
This is Francis, neither of these departments have a part-time line item either.
Okay, sounds like we've got some working out to do here. So would the court be comfortable to deferring it until but you have to submit what information you want for the next meeting, but defer it action today, and then we'll bring it right back and try to deal with it. It's appropriate for Judge Hensley and Judge Perea. That also fits our kind of what we're wanting.
Well, since I didn't get a second, I'll make the motion to defer.
Okay. There was a second. There was a second.
I'll amend my second.
Okay, thank you.
Okay.
All right. So we have a motion to defer, and now Commissioner Jones, you second that?
Yes.
Okay, thank you. And any other discussion? No other discussion, call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller,
Aye.
Judge Bolton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. Thank you, Judge Hensley. We will.
Okay, thank you, and we'll try again.
All right, thank you. All right. Let's see. On Commissioner Talbot, Amanda, you weren't duly elected, but Amanda, on item F1 regarding the incentive pay, I think Commissioner Perry and myself have both asked that we hold off on incentive pay discussion until we get into the budgeting process, so we kind of know where we are. But for some reason or other, it keeps surfacing back up. But I'd like to defer that on item F1. I'll make a motion, we defer F1.
Second.
Have a motion second. Any discussion? No discussion, call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller,
Aye.
Judge Bolton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. And then on F2A regarding the part-time wage increase, Amanda?
Yes, so this is a particular request coming from Constable Precinct 1. He has 3 individuals currently in a part-time position. He is trying to add additional part-time staff. He is requesting the ability to change his $15 per hour currently approved value to $20 per hour for these part-time law enforcement officers. I pointed out in my memo that Precinct 5 is currently paying at the $20 per hour for their part-time workforce. I also provided that Precinct 4's hourly law enforcement is only $10 an hour. Currently, Constable Precinct 1 is utilizing this particular line item of their budget. Obviously, they will go through the funds in their budget faster if they pay at the higher wage, but their request is to increase from $15 per hour to $20.
Wouldn't that be more appropriate to discuss that during the budgeting process?
I agree.
Well,
I
they would
think we
like
need
it.
to hold that for budget.
So they were requesting this be effective immediately.
I understand. Is anybody,
Make a motion to deny.
is there a second? Dies for lack of second. So what does the court want to do?
Well, how do we,
Yes, oh, I'm sorry, go ahead.
I think we're about to say the same thing, Commissioner. I think if we're wanting to discuss it for budget, does it require action today?
I guess Commissioner Snell's motion is appropriate because it's asking for current deal, but he didn't get a second. So in other words, do we want to consider it for the current budget year? And if not, then we deny it and recommend he bring it back during the budgeting process. You know,
Okay.
I think I'm reading that right. Because, and his point was, he's got a certain amount budgeted, that's true. But he's going to burn it up quicker if he goes from 15 to 20, which he understands that. But, there again, we have a lot of disparity between $10 an hour.
No, I follow what you're saying.
Yeah.
I just didn't know if we could, but maybe Commissioner Snell could restate his
Yeah.
motion.
Okay. Commissioner Snell, so I guess the question is, do you want to restate your motion? And I guess
Before we do that, because I'm thinking he's going to entertain another motion to deny. I thought she said that we have a constable deputy position, part-time positions that are earning at $20 an hour. Did she say that?
She did, but if we could, let me get a motion and a second, and then we'll go into discussion. Okay, so Commissioner Snell, you make a motion?
I'd make a motion to deny the request at this time.
All right, is there a second?
Second.
Motion been made second. Now we can talk about it.
Okay. Well, I was hoping to talk before we put a denial on the table. My only thought would be if we have positions that are being paid at $20 an hour, and if we keep him to the confines of his budgetary restraints, I just didn't know if we were being equitable in denying his requests. And so I just really had a point of clarification. That's
Okay.
what I was wondering.
Well, and it's, if one is, there again, if we're paying $10 in one precinct and 20 in another, you're right, it's not equitable. But the appropriate time to discuss that would be during the budgeting process, where he can come back and request his part-time and define, to be specific about how he utilizes that budget as to the people and how much per hour.
And in essence, by approving that, we're approving an increase in the budget next year already. So it's probably wiser to discuss it at that time.
Yeah, at that time. Any other questions? We've got a motion and a second to deny the request. If no other discussion, call for a vote.
Commissioner Snell. Commissioner Miller.
Aye.
Judge Felton.
Aye.
Commissioner Jones.
Aye.
Commissioner Perry.
Aye.
Pass. Okay, under F2B regarding new hire to fill a part-time position. Amanda? This is.
Yes, so this is a request from Constable Precinct 1. Again, this request is specific to wanting to hire a deputy to fill the position. They've completed the affidavit paperwork and the application paperwork. So this is just a standard request to hire a part-time employee that requires court approval.
And he already had it in his budget, and it's replacing another part-time person that was there.
I don't know if it's replacing another person. Again, he can hire as many part-time employees as he would like, as long as he sustains his accounting of monies to ensure he does not exceed the budgeted value for part-time employees.
Well, I'm wondering if we're increasing staff or we're replacing somebody. Because the
I
court's,
don't know that I know the answer to that.
okay, the court's been pretty clear that we consider those when the data is brought forward that shows that there's a need for an increased position. I don't believe I've seen that.
Again, related to part-time employees, if they're, I believe the court has been approving budget for part-time in the budget line item, and then they approve a dollar value that can be paid for part-time employees. So ultimately, the department or office can employ as many part-time staff as necessary to complete the work, as long as they do not exceed the dollar value that was approved by the court. Francis, can you confer that that has been the history?
Yes. So as y'all give them a max budget for part-time pay and an hourly rate, and then they just have to, of course, live within that budget. So if they want to hire one person or 5 people in that part-time slot, that's just kind of up to them after they're given the budget.
Anyone have any questions? You understand that?
So we don't know if this is an additional staff member or replacing staff, correct?
I don't know that. That's true. I think so. It's the part-time money was approved, and I guess what Amanda or Francis are saying, you can hire as many part-time people as you want to until the money's gone. Is that?
That is correct.
Okay.
Yes, sir.
Okay.
And that's for all offices and departments.
So is this a $15 an hour or 20? I mean, we already turned down the 20.
Correct, because you've denied the request to pay the part-time workforce at the $20 rate. It would be at the $15 an hour rate.
Okay. All right. I understand. Well, it seems like he's got the budget to do it, and he's got the authority to go ahead and move to hire that person.
I'd make a motion to approve his request.
All right, we have a motion and a second. Any other discussion? No other discussion, call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller,
Aye.
Judge Bolton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. Okay, Amanda, while you're on, we will get your report that you're just going to hit the highlights on and not get way down into the tiny details, but you got the floor.
I'm not going to get into the tiny details, but I do have some things to point out with regard to my report, and I feel like it is important to do so, not just for my staff in office, but also given the request from the court to highlight any challenges or COVID impact to the Human Resources Department. I want to speak to that request.
Okay.
So I do apologize. I'll take a little bit more time than I have the last couple of activity reports. So with respect to our recruiting activities, the Human Resources Office has had an increase in the number of individuals coming directly to our office to complete applications. They are using our computer kiosks to complete those online applications, but they are coming in person. We're seeing more of those even during the shelter-in-place orders than we had seen previously, so I want to make the court aware of that. The second thing with respect to recruiting is that the Texas workforce has been closed due to shelter-in-place orders, and so they could not conduct our applicant testing that we have for several of our positions. Even when we opened back up, they were in operational setting to open back gradually or slowly, and so they were not able to administer those applicant testing protocols. So in essence, that meant we were doing it. So the Texas workforce was supplying us with the testing tools and assessments. We had applicants coming physically in person to our office. We were utilizing the additional space that we have been blessed to receive from the constituents in the Commissioner's Court and the team members in the Space Committee to give us that space. It's been greatly needed at this time.
because we have had applicants come in and complete those testing requirements. So they're taking tests on typing speed and accuracy, they're taking spelling tests, they're taking tests with regard to legal terminology and language, they're taking software tests such as how well do they know how to operate Microsoft Word, PowerPoint, Excel, those sort of things. So Human Resources has been meeting with those applicants, helping them get set up for that testing, ensuring they complete the testing requirements, and then we receive the scores from the Texas workforce, which we supply our hiring managers. So even though we've seen less overall numbers of applicants, and though some of our recruiting activity has been slowed in the sense of the number of vacancies we have open, we have had more direct involvement from the human resources side to conduct that recruiting activity. So I wanted to be sure to point that out. There were a lot of comments by other offices or departments thinking we were not recruiting during this time, but if we have had a vacancy, we are actively engaged in the recruitment process to acquire applications, to screen those applications, any involvement with the interviewing process, the background checks, all of those activities are still ongoing. With the addition, we've been helping applicants face-to-face in person who have come to complete online apps and to conduct the Texas workforce testing. So I want to be sure that you're aware of that we have had actual more volume of visitors than is normal for our office during this period of time. The other thing I want to comment on is we have had our standard operations as far as the data that we are making changes for. So name changes, direct deposit changes, salary adjustments. There are typically a lot of salary adjustments made during the window of time between the start of the new year and the performance review process. A lot of offices, if they have the budget funds available and their employees are not maxed out at the budget fund, will provide salary adjustments towards that end of the performance review process if they have the funding available in their budget to provide adjustments to staff. So we had an increased volume of that during this time. That's normal on an annual basis, but I want you to have the awareness that that's an increased activity for us while we've also been addressing these other activities required of this office due to the COVID impact. So I just kind of want to point that out to you. Additionally, in that report is information regarding the offices that exceed the comp accrual hours. It seemed like that came up recently on the Commissioner's Court discussion and the discussion to request data related to the offices that have exceeded either their comp accrual hours or their vacation hours. So we provided that in the report for you. I hope you took note of that. I don't know if you see our entire report or if you're just seeing sections of it, but wanted to be sure you knew we did incorporate that detail for you. With regard to our leave of absences, something the court probably needs to have better awareness of is, yes, we're having to process those COVID-19 related requests initially between March 15th and April 1st. But then when FFCRA became implemented as of April 1st, we had to also begin processing those leaves. Those are two different leave types, as we mentioned earlier in court discussions. There's the 80-hour paid leave time for FFCRA, and then there's the time related to family medical leave. It's an extended family medical leave for those individuals impacted by COVID-19 that have to provide child care support and resources while child care facilities are closed. So that child care extended leave benefit of FERCRA, or FFCRA, excuse me, is the same type of family medical leave processing as any other family medical leave status. It's the same volume of paperwork, same volume of action, same volume of interaction with the employee. Then we also have to collaborate with the department or office to ensure employees are adhering to, if it's an intermittent-based schedule, the agreement of that intermittent schedule, adhering to any doctor's restrictions, that we are collaborating with that department or office regarding any modifications that might be needed given work restrictions that they have. So sometimes this overlaps into ADA processing as well. So it's very similar to our family medical leave processing for these absences. The employees on leave at the time of this report, again, it's increased significantly in the last couple of weeks here in June. But at the time of the report, there were 85, which is a 67% increase to our normal volume of activity. And then when you see the COVID and FFCRA extended leave, there are 166 individuals that received the FERCRA 80-hour leave and the extended childcare leave, which was a 277% increase activity to our work volume. So I really want everyone to have an understanding that basically we are doubling our volume from last year's leave activity, and that's calendar year, it's not fiscal year. So we're about halfway through the year and already trending to be doubled. That's a significant increase to our operations and definitely an impact to us from a COVID-19 response and situation. So I just kind of wanted to be sure to point that out to all of you. There are several points of data related to our FFCRA and COVID-19 leave statistics that we've supplied to you in this report that are different from our normal reporting measurements or data analytics. So I wanted to express that to you as well, that we've supplied that information. We'll update it in our next activity report as well, given there's been significant changes here in the last couple of weeks, and it's forecasted that there will continue to be changes in the next several months, I presume, based on discussions in court this morning and what we see in media. So I just want you to be aware that that activity is requiring additional volume of this office. It's required extended hours for myself. I've had team members that have also been impacted from a child care standpoint, but have had to modify their schedule at varying points in time, yet our activity and responsiveness is still needed to all these offices, and our actions are time sensitive, and if we're not able to deliver timely, impacts the auditor's office and the treasurer's office negatively. So it's really critical that we're able to sustain all of the work volume, and I want you all to know the work volume has dramatically increased, and we are behind schedule in several of our regular activities due to this increase in leave of absences. The other thing I would like to point out to you today is it's been mentioned by a couple of others in their reports. We're in the middle of the RFP process for our TPA and a couple of our ancillary products. That requires a good bit of time as well to participate in RFP discussions and meetings and presentations. But ultimately, I would like the court to be aware of the fact that given our change in social distancing and protection of staff, we are no longer going to be able to offer the online and the enrollment process in person. We must move to an online enrollment process so that employees are able to make changes to their benefits remotely, either from their computer kiosk that we could supply to them, or with most of these products, we've been seeing an interface from their phone, a cell phone device. So that would be good news if we can implement one of those software systems so that our employees could make those elections without having to come in person. And again, typically when we conduct annual enrollment, we are utilizing the Annex courtroom, and we have large volumes of individuals in that courtroom that we just cannot continue to allow given the restrictions that are in place today and to ensure everybody's safety. So we must move to an online enrollment system. To do so requires a good bit of implementation and collaboration to ensure all of our current data that our employees have for their current elections would be uploaded into that system, but also whatever the court decides for our new elections and new providers, we need that data into the system as well, so that employees are able to make their selections and make their choices on a handheld device. That is going to require a good bit of work from this team as well when we are already stretched given the leave of absences we have. So you've asked us to point out any challenges in COVID impact, and much of my report is providing you just that. And I feel it's important to make you aware of the constraints we have in our office. I'm finished.
All right. Okay, does anyone have any questions for Amanda?
I'd just like to second what Amanda has talked about on the open enrollment. I don't see any way that we can have an in-person open enrollment in the early fall, late summer, with the situation the way it is.
Okay, thank you. Any other questions? All right, thank you, Amanda. Okay, is there a motion to approve Amanda's report for recording purposes?
Motion to approve.
Second.
Motion been made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller, Judge Bolton,
Aye.
Commissioner Jones.
Aye.
And Commissioner Perry stepped out just briefly. So it's we pass. All right, going to
Judge.
Yes.
We still need to cover D13.
Pardon me?
D13 under the report, the last report.
D13, okay, we do have, yes. Under D13, Texas AgriLife Extension Service Monthly Activity Report. The report's in your package. If there's any questions, we can call Dr. McClellan. And so if there's not any question, I'll entertain a motion to approve the report.
Motion to approve.
Second.
Motion made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller,
Aye.
Judge Bolton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. Thank you. Under E, under budgets, budget amendments, transfer and changes, E1 is regarding the FY21 budget. Is Francis on?
Judge Francis messaged that she had a 2 o'clock appointment. She could not move.
Okay.
But what this is, it's a line item transfer totaling $160 for cell phone charges for July, August, and September, and charges for a notary bond. It also goes along with item G3 on the agenda.
All right. Any questions? Not, is there a motion to approve E1A?
So moved.
Second.
Motion been made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller,
Aye.
Judge Bolton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. Under F2 regarding the FY21 budget, under E2A is Waco McLennan County Library authorization of funding allocation. The county's portion of the funding for the Waco McLennan County Library for FY21 begins on October the 1st of 20, and it's proposed to be at a maximum of $933. $933,464, revised from the 615 budget to the adopted budget from 2020 was $912,890. So it was $912,890 in the 20 budget, and the request is to increase that by about 20,000 to $933,464. The amount of is for level 1 support and represents 1/6 of the total eligible library operating expenses. What's the pleasure of the court?
How about the documentation I have that shows that the new is $1,050,439. What?
That was a mistake. That was wrong. It came from the accounting, and that's been adjusted to $933,464.
I make a motion that we approve this.
Okay, is there a second?
Second.
Motion been made and second. Any other discussion?
Yeah, my discussion is with not knowing where we're going to be at on our budget, I am not in support of committing any additional money until we know where we're at. This is going to be a tough budget year, and there maybe have to be some changes, and this may be one of them that we have to change.
I understand that. I had a question, Judge. Are we in an agreement with the city of Waco where our funding level has to be sent to them at a certain time or something?
Yeah.
That's correct. We do have a contract with them, and through it, we're required to set our level of participation by July 1st of each year.
July 1st.
Any other questions or comments?
I think there will be plenty of places to make cuts and the libraries in Waco and throughout the county, the smaller libraries do a good job.
Any other
And
discussion?
this funding isn't going to the smaller libraries. This is only going to the Waco libraries. We do our separate funding for the smaller libraries.
I know that, Kelly.
All right, any other discussion? If not, call for a vote.
Commissioner Snell,
Oppose?
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. Okay, let's see. G1. Okay, under G, under additional items for discussion. G1's authorization of recommendations. Under G1A is regarding the RFP 20-017 Cal Bio Watershed Flood Control Structure number 3.
Yes, sir. We received proposals from HCS Inc., More Watershed Services, and More Excavating LLC. We recommend that McLennan County grant the award for Cal Bayou Watershed Flood Control Structure number 3 to More Watershed Services. More Watershed Services submitted the best evaluated proposal. They have worked with us before on cleaning up some dams. So they've worked with both the Texas Soil and Conservation Districts and watershed authorities, and they've worked for McLennan County. That was a large extent to our consideration to request or recommending the More Watershed Services for this project.
Okay, thank you. Any questions? What's the pleasure of the court? I make a motion that we grant the award for Cal Bayou Watershed Flood Control Structure number 3 to Moyer. It's MOIR Watershed Services. Is there a second?
Second.
Motion been made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller, Judge Felton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. Under G1Bs regarding the RFP 20-018, this is the Cal Bayou Watershed Flood Control Structure number 8.
Yes, sir. We see 2 proposals on this. We received a proposal from HCS Inc., and we received a proposal from More Watershed Services. We want to point out that More Watershed Services submitted an incomplete proposal. Therefore, we recommend that McLennan County grant the award for Cal Bayou Watershed Flood Control Structure number 8 to HCS Inc. And again, because they submitted an incomplete proposal, HCS submitted a complete proposal. Therefore, that's why we're recommending HCS on this project.
And they've done work for us.
That
before.
they have, not exactly for dams and stuff, but
Right,
they
but
have
other-
done other work for us, yes.
Okay. Okay, I'd make a motion that we approve this. Is there a second?
Second.
Motion been made, second. Any other discussion? No other discussion, call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller,
Aye.
Judge Felton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Aye.
Pass. Under G2's discussion or action regarding the Commissioner's courtroom equipment upgrade for managing remote meetings. Lisa?
Yes, sir. This item is coming back around. We've talked on this the last couple of meetings, discussing the problems that we're having managing the Commissioner's Court Zoom meetings with the existing equipment in our courtroom. So we have had some further visits with some multiple vendors to look at what kind of solutions they recommend. And we have a presentation that Tim is going to provide for you that kind of identifies what issues need to be resolved, what those solutions look like, and so he'll go over those details. In addition to that, I also wanted to point out that the Civic Plus product that we use for our agenda management and video hosting, they have an upgrade that is coming out that it's not optional. We will have to proceed with that. We have to do that before the end of the year. We think it would be a good idea to companion these changes at the same time, and have met with them, looked at the product. We had someone from the county judge's office who manages the agenda, and also from the county clerk's office where they're doing the meetings and bookmarkings and stuff for the videos, to look at this product with us. In the past, we stayed with BIS because it provided the ability to isolate the audio sound. So that was one of the stipulations we have to have in any product that we use, and also the ability to record locally in addition to any live streaming or features that come with a lot of these systems. So Civic Plus has shown that they can meet those needs now. I don't think there's any opposition to looking at moving that direction. There will be a change in cost for that service. So currently, we renew with BIS in February. That cost has run us about $1,969. I don't know what next year looks like. I'm not sure whose budget that comes out of. It may be the county clerk's budget. For Civic Plus, that has been costing us $6,550, and that was short some of the features. Now that we would be looking at this as a turnkey product, that price has changed. They've also merged some of their services. So that new cost, if we were to go wholly over to Civic Plus and not renew with BIS, that new expense would be $11,100. Currently, the combined cost is $8,519. But we're having to work with two different products, older camera, there's some things there. We feel like the all-in-one solution would be better and move us towards the improved technology that we're looking for. So with that said, I would like to point out, we did have some issues again with our PA system. We are having a failing component that was in the PA system. We have found a way, or our team has found a way to work around that. They are utilizing someone's personal equipment to get us by in the moment. So I appreciate that staff member for providing that, and for the team to continue to juggle with the tools that they have. So I'm going to turn this over to Tim now to walk through his presentation.
Okay, thank you, Tim.
Afternoon, Court. Can you all hear me?
Yes.
Yay. All right. I have a quick presentation I want to share. Hopefully it's not too lengthy. Give me 1 second. Can y'all see my screen?
We can.
Very good. All right. First, wanted to point out the existing problems I've noticed in our various commissioners' courts that we've held is the continued audio degradation. We have received noise from the room. We've received noise from failed audio or wireless devices, mics, and the gooseneck mics that are actually there at the commissioners' desks. And then, of course, the lack of control or ability to set auto configuration levels for the speakers and audio devices in the room. A couple other things that we encounter are congested network traffic. This is occurring because of the increase of wireless devices in the commissioner's court space. And unfortunately, Zoom really is only as good as the weakest connected device. So say if someone's, participating in the Zoom presentation on a mobile phone or a wireless tablet, Zoom is only going to be as good as that device's bandwidth will allow. So that could potentially bring everything down. Another complaint that I've received is lack of video on each participant. Some people have complained that they can't see Commissioner Perry. They can't see the faces of the presenters. All they see is their backs. So a couple things that we've discussed with various vendors to correct this. First and foremost is the audio corrections. We replaced the PA system in the corner with a digital sound processor. This will give us enhanced noise cancellation, enhanced audio controls, and audio presets for individual persons. So we could basically set a level for each member of the court. So that way we wouldn't have to go in and constantly be tweaking little buttons all the time. Improved microphone speakers. The speakers that sit in front of you right now have about a 90-degree angle. So it's straight on ahead. What was recommended is shorter microphones, 12 inches instead of 15 inches, and it's more of a 111-degree, almost maybe 120-degree angle area spectrum. So you don't have to be directly in front of the microphone, and it will still pick up good audio. The other thing that we are looking at doing is providing a dedicated conference phone for Commissioner's Court. Judge Felton, if you'll look in front of you, you see a conference phone there, but that is actually the IT conference phone. We'd like to replace that with a 10-inch touch display that would be tied directly into the digital sound processor. So any calls that are made from or into Commissioner's Court will still play over the in-house audio. For the video corrections, there's a couple of things that we could go with. Wall and ceiling mounted cameras. This would be fed directly into the new IT host computer that's set to come here soon. And each presenter would basically have a camera feed. So we'd have camera feeds for each commissioner and as well as the judge, and a camera pointed at the presenter table. And I do have a document image that I can show you. The other thing that we're looking at is enhancing our production level software. This would allow for picture-in-picture, better presentation management, so we look a little bit more professional when we're broadcasting across YouTube. And then it also provides smoother transitions from setup, meeting opening, going into recess sessions or executive sessions, and it just provides a more professional aesthetic. That production software I've been testing for the last month, and that is OBS, which is Open Broadcast Software. It's free. For the most part, it's easy to use, easy to train on. One of the caveats I found with it is it doesn't include remote video feeds. So if we were to do the translator, they would either have to stay remote as they are, or they have to come on premise. But one thing that I can do with that is I can do basically a video inlet where the translator stays above all the video presentations. So like my presentation right now, you can't see the translator, but you would be able to with this particular software. There is a paid version called Wirecast. It's $800 flat fee. There is $300 of annual support if we wanted to choose for that, but it will allow for remote video feeds. So say the translator, we want to keep them remote, we could incorporate their video into our feed. The current release I played with did not work very well. However, there is a new release on the horizon, 13.2, that corrected all the bugs I found. So just one of those things. Here's a diagram of the static wall-mounted cameras. Spoke with Logan at Brazos Media, and this is basically what he recommended. Is we have 2 cameras mounted to the wall that would be pointed directly at Commissioner Snell and Commissioner Miller, and then 2 other cameras on this wall pointed to Commissioner Perry and Commissioner Jones, and then 2 cameras here, 1 pointed to the presenter table and then 1 to Judge Felton. That will allow for, even during presentations, for the primary members of court to be seen. And if anyone is giving a presentation in court, they can also be seen. An advanced thing that we could potentially look at doing to improve our sound quality in the Commissioner's Court is by providing sound dampening padding. Some of the examples I found were obtrusive and ugly. However, it can be done a little bit more aesthetically. Here are a few examples I found of an area Commissioner's Court. They used the sound padding in more of like a abstract mosaic art piece on their wall. An additional feature that we could do, which mimics the Bosque Theater, which was also set up by Brazos Media Group, is to do desk inlet monitors in conjunction with the wall-mounted cameras. Instead of y'all having to look at the large screen all the time, you'd actually have your own inlet 24-inch monitors. The only caveat with that is it would require modified furniture. We would not be able to use the furniture you have right now. But if you have not seen the Bosque Theater, this is what they're using. And Nova Solutions is the one that provided that technology. Aside from that, I am also meeting with a company called Rushworks, and they are actually the ones that provide the camera controls and software for the city council feeds over at the Bosque Theater. I'm also meeting with RBDR Architects on Thursday as well, and they are also the company that set this up as well, just to kind of get some ideas and maybe some pricing from them. But aside from that, those are the things I found and kind of the recommendations I would like to look into, given the court's approval to move forward. Thank you.
Yeah, thank you, Tim.
So with that, we're basically looking at, I guess, 3 layers of solutions. First and foremost, the audio definitely, could use, an enhancement. And so we would, like to ask the court to support us in upgrading that. We are getting figures on that expense now. For the second layer, we could consider upgrading to the individual cameras if that is still of interest, as opposed to the single view that we have in the courtroom now. And, the different members feeling compelled to bring their mobile devices into that space. And then the third phase being whether or not there's an interest in having a display dedicated to each member of the court. Also, one of those reasons you're probably bringing in your own device to court. I know we've tried to have the TVs positioned in a way, that you can see those presentations, better, but, it may not, fit everyone's exact need. So we do have those 3 options. We will be bringing numbers back to the court and what, and any associated cost with supporting additional digital media in that space. I need to get some more costs on that. The furniture, we do not have any costs on if you're interested. And so I think at this point, really, we're just looking for some direction from the court on how, are you interested in just that first solution? Are you interested in going into that second or third solution before we invest that time?
Well, I would say, like I said to start out with, that we're probably going to be doing this for a long time. And I think the court would like to know the cost of each segment. I know it's trouble to do that, but so the court will have an option to kind of select something. But I think, equipment's been the problem and we don't need to patch anymore. We need to fix this. There's probably, in some of our bond funding or ADA or things like that, I'd have to talk to Francis about that, about how it could be funded and not out of the, the cash budget side of it, but we'd have to look at that. But I think we need to see all the different levels of advancements on it. So,
Okay.
any other thoughts anybody have? I think Commissioner Jones, you've been saying that for a good while.
Yeah, I would like to see the pricing though. I think that's
Yeah.
important before we move forward.
Sure.
Okay.
And if there's any way that we can see, a full package and what Brazos Media recommends and things like that, that'd be
Okay.
that'd be nice to know.
We do have some initial numbers. Like I said, I've got some associated costs that we don't have back. Tim would have to help me out on this. I believe the first solution being audio only. Tim, was that figure around 17?
That was $18,575.
Okay, and could you go over what we get for that price?
Sure. I'm basically just going to go with the scope of work that Logan pointed out. Existing analog mixer to be replaced with digital audio server with advanced digital sound processing and acoustic echo cancellation. Audio server has the capability of a voice over IP endpoint, which is where the conference phone comes into play, allowing it to participate in a conference call. Client would provide that, of course. Audio server also has bidirectional USB capability, allowing it to send and receive audio from a computer running a soft codec video conferencing application such as Zoom, so it would be tailored to our Zoom environments. Existing 18-inch microphones with narrow pickup patterns would be replaced by 12-inch microphones with wider cardioid pickup pattern. It's technical, basically just saying it has a broader spectrum. Small personal monitor speakers will be placed by each local participant to allow them to hear each other as well as remote participants. This setup is actually in place already at Bosque Theater. So basically, if one person on this side is talking, they are not being fed back their own audio, but the person on the other side can hear them. 10-inch tabletop touch panel will be programmed for control of the entire audio system, including levels of microphones, voice over IP dial control, and muting of room ceiling speakers. Panel can be mirrored by a client provided device with network access for control by multiple individuals, basically be connected to a computer. And an HDMI extender will be installed for wired connection to TV from computer running conference soft codec.
And with the microphone system, we would be basically removing the wireless microphones. I mean, we would still have them, but
we would have a few wireless on hand, but the presenter mics would go straight wired.
Yes.
Sorry, didn't mean to interrupt.
No, that's okay. We will, of course, have them on hand. They're bought and paid for, but the idea is to use the hardwired because we will get better results with that. What we have currently is ideally used with about a 6-inch gap between the speaker and the microphone. And that's why we oftentimes can't hear those speakers because they are sitting 1 and 2 feet back from those microphones. And it's hard to get somebody to stay up on top of that. And given the circumstances that we're in, I don't think we want to be using that microphone one behind the other with it being so close to our mouths. So we would be increasing the number of the microphones in that space. Some of the other, we talked about the integration with the Zoom platform. That is another feature that has been worked into the Civic Plus product. It would allow us, with the addition of either OBS or the other software. Wirecast, thank you. Giving us much more control at a single station. We could definitely move from the 3 people that are managing these meetings easily to 2 and possibly 1. These controls are simplified and brought to the desktop. It's more software driven instead of hardware driven as it was previously for the encoder. So, so there's a lot going on in this package. We are getting a number of solutions in this. The preset microphones, I think, are a huge benefit. We can preset them to those individual people. So when they sit down from week to week, it's set perfectly for that person. A lot less manipulation by IT. So that's the cost for that solution, for audio only and those levels of controls, bringing the phone in. Now, if we go to the second layer, which incorporates, I think, the cameras on top of everything else we just discussed, how much does that cost increase, Tim?
It increases quite a bit. Unfortunately, it moves up to $32,650 on top of
Total, in other words, it covers the 17 and then it goes up.
Yes.
Yeah.
Right. This pricing
Inclusive-
includes phase 1 and phase 2.
Yes. And that gets us 6 cameras, I believe.
Yes. 6 fixed and 1 PTZ camera to be added to integrate with video conferencing. Camera signal would be made available on SDI cabling to a computer input card provided by us. So the
And
computer
then-
system we have on the way, this would tie into.
Yes, we are still waiting on that. Again, there's a delay in getting equipment, so hopefully we'll have that soon. And then the third phase that we discussed, this number would be for the inclusion of those monitors. It would be without the furniture. We haven't been able to meet with that vendor yet.
That'll
Tim,
be
what is the
Thursday.
cost when you incorporate the dedicated monitors for each?
That
commissioner?
moves phase 2 to phase 3. That goes up to $37,100. But that will also include revised furniture, because the existing furniture will not hold those mounts.
So it does cover the furniture.
It does not.
Does not.
Oh, okay.
Yeah.
Yeah, we don't believe we can use the existing desk because of the material it's made out of.
Okay. All right.
So those are those initial expenses.
Okay. All right.
And
And
did
that is
that,
with, go ahead.
did that include the audio corrections, the sound panels and things like that?
Oh, you're right. It does not include anything, any sound buffering on the walls either. Tim, have you found a vendor to help us with that yet?
RBDR does it,
Okay.
and I'll be speaking with them on Thursday. So.
Okay.
I would say that the 37,100 is an incomplete quote because we don't have the furniture piece to accompany it.
Any other questions? Okay, I guess I think the decision of the court is they want to move forward and see what the full package ends up being, and then we'll put it as an action item from that standpoint.
Okay.
Well, in the meantime, we'll figure out also the funding on it, how we finance it.
Yes, sir.
So I need to talk to Francis on that.
Okay. Would you like us to carry this over to the July 7th agenda?
Yes, please.
Okay. And hopefully we'll have some updates by then. If not, we could defer.
Yeah, if it, don't bring it back till you have everything, but if it's ready by then, bring it to court. Okay?
Yes, sir.
Anyone else have any questions or comments? All right. I don't think there's any need for action then. Thank you all very much.
Thank you.
Going to item G3 is authorization of smartphone request for Justice of Peace Precinct 1, Place 1, and also Justice of Peace Precinct 1, Place 2. Ken?
Yes, sir. We received requests from Judge Hensley and Judge Peterson. Judge Hensley would like to change her current county cell phone, which is just a basic cell phone, with service of $22.99 plus taxes and fees per month for basic phone service to a smartphone. That will be a monthly fee of $39.99 plus taxes. Judge Henley stated that she has funds in her budget to accommodate the expense. Judge Peterson has also requested a county cell phone. He would like an iPhone to assist him with his justice of the peace duties. There's a charge for the phone, no charge for the phone. The monthly service is $39.99 plus taxes and fees with Verizon Wireless. I believe we had a budget amendment go through earlier to cover that extra expense. Now both Judge Hensley and Judge Peterson are switching to Google Calendar, and switching to the iPhones would help coordinate courtroom schedules. And that's part of the reason that they're wanting to switch.
Okay. And then currently, Justice Peace Lee has a smartphone, and JP Perea has two smartphones.
Yes, sir.
Okay. Any questions anyone have? If not, what's the pleasure of the court?
Make a motion to approve.
Is there a second?
Second.
Motion made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Snell. Commissioner Snell.
Aye.
Commissioner Miller.
Aye.
Judge Felton.
Aye.
Commissioner Jones.
Aye.
Commissioner Perry.
Aye.
Pass. Okay. Going back to the supplemental agenda on B1, under BS budgets and budget amendments, B1 is regarding the FY20 budget. Under B1A is Justice Peace Precinct 3. This was deferred last week. This is to transfer, it's in the budget, transfer from contingencies to the Justice Court Security Fund, $9,600 for on-site security guard to maintain traffic when the court opens. So, any questions on that? It's primarily to manage traffic coming in and out around the COVID-19 situation. And like I said, it is in his budget to do so. Any questions about that? What's the pleasure of the court? I make a motion we approve. Is there a second?
Second.
Motion been made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Snell.
Aye.
Commissioner Miller.
Aye.
Judge Felton.
Aye.
Commissioner Jones.
Aye.
Commissioner Perry.
Aye.
Pass. Anything else?
But did we cover item F3?
What is it?
F3?
F3.
Mm-hmm.
We covered that, Mercedes.
Did we? Okay.
It's covered. Yeah. Okay.
And Judge, I think on the supplement, on the emergency supplemental, that we just need to pull C1 with no action.
Okay, I thought I did that. I'm sorry. Okay.
I might have missed it, but.
Okay, under C1 on supplemental, I'd like to recommend to pull that with no action. Okay, anything else to come before the court today? If not, we stand adjourned. Couple days work. So